Okay, I think we'll go ahead and get started. First of all, just welcome to our orientation session this morning for your IPPE course. We're excited about some of the things that we're sharing with you today, and we have a number of things lined up. So first of all, we'll be doing HIPAA training. So we have Lindsay Daniel here to help us with the HIPAA training for the first hour. Once that's done, you'll be certified for HIPAA for the year, and so we'll do that. We'll also introduce to you what IPPE actually is. We'll give you an overview of the IPPE curriculum for the year, and then we'll talk about your syllabus and service learning opportunities, and then we'll overview Cornerstone Experience, which I don't know if you've heard about the Cornerstone Experience really at all so far. So we have Dr. Gray coming, and he will talk to you about what the Cornerstone Experience actually will be for your IPPE. And then we'll talk about professionalism. I believe you talked about professionalism yesterday, but we're going to talk about it again. We have you received in your email yesterday a contract. We'll be talking about that contract and some of the specific things in that. And then at the end, hopefully we'll have some time for questions. I have a feeling we'll probably be done before noon, but you're scheduled until noon in this room. And so with that, I'd like to turn this over to Lindsay Daniel, who will talk about HIPAA.
Good morning. Good morning. Welcome to ETSU. We're excited to have you guys over here at the College of Pharmacy. I am Lindsay Daniel. I'm the Assistant Counsel for the University, and I'm also the Acting HIPAA Compliance Officer. So if you ever have any HIPAA questions, you can call me. We're going to do your HIPAA training this morning. This will be a 1-hour thing. It certifies you for the year. You'll have a certificate in about a week. You can print off a line so that you'll have for your own records if you need it. And then each year after that, you'll get a reminder automatically, and you just do it online. You don't have to see me every time. Let's see. I think I can go to my slides here. Okay. If you have any questions, just please raise your hand and ask them during the presentation. I think sometimes some of the biggest issues that students have questions about kind of come up as we talk through this stuff, so feel free to interrupt me. I'm happy to answer questions about the stuff that we talk about or anything else that you might have that you've thought about coming in. I'm sure you guys have heard of HIPAA before. This is not your first experience, but I kind of want to give you an overview today and then some of the specific policies and procedures that ETSU has in place to protect you so that you understand how our secure systems work. So what is HIPAA? HIPAA is a federal law. It came out first in 1996. And it was really an effort to protect privacy of patients nationwide. So before 96, all of our providers were kind of doing their own thing when it came to patient privacy. There weren't any specific regulatory requirements. So patients' information was kind of protected differently based on the provider, based on the state. So in 1996, the federal government decided we really need some kind of privacy floor that all people that deal with healthcare information are going to meet so that we make sure patients' privacy is protected. The easiest way to think about HIPAA is in two major pieces. The privacy rules, what we'll talk about first, that relates to patient privacy. And the second piece of the regulations is a security rule that really relates to the security measures that we're required to put in place to secure that patient data when we come in contact with it. The basics, so HIPAA doesn't apply to everyone. It applies to these categories of people. So a health plan, so insurance companies have to abide by HIPAA. Healthcare clearinghouses, that's the people that process your payments for when you enter claims and things like that. And then healthcare providers, so that's you guys. You'll fall into category 3. So you have to follow the HIPAA rules when you're dealing with patient information. In 2013, the government decided to add what we call business associates to these categories, so it applied to a 4th category of people. And a business associate is basically somebody who's not 1, 2, or 3, but who's going to get health information in some way. So this is like your electronic medical records vendors. So they wouldn't have normally had to follow HIPAA, but if you think about it, they're holding all of our patient data. So your whole pharmacy system, that's where all of the information is going in. Those people who created those networks didn't used to have to follow HIPAA. So in 2013, they said everybody who touches it to do something for one of the people in the first 3 categories is going to have to also follow the HIPAA rules. Okay, we'll start with the privacy rule. So protecting the privacy of PHI, that's protected health information. Basically, the privacy rule in summary says we have a duty to protect this information that the patients entrust us with. And if we don't do it, we can be actually civil or criminal fines and penalties. So they take patient privacy very seriously. They're really ramping up HIPAA enforcement right now with all, I'm sure you guys have heard about all these hacks that are going on with insurance companies and hospitals and stuff like that. So HIPAA is really ramping up, I think, nationwide at this point. So we're really trying to make sure everybody has all the information they need to do what they need to do. So HIPAA applies to what we call PHI, so protected health information. The easiest way to think about what is PHI is it's basically anything that has to do with that patient that you're going to come in contact when you're in the pharmacy or the clinic. It's everything that has to do with them. Billing information, demographic information, obviously their diagnosis, their medications. All of that stuff that's related to the individual is all considered PHI. So all the rules we'll talk about apply to that information. So what does the law require? Sometimes people, when you hear HIPAA and there's all these big hacks and stuff going on, people are getting large $1 million fines, people get really nervous. In reality, HIPAA is very important, but it doesn't really make us do all these extra steps. It's really reasonable steps, reasonable efforts. If we're doing what we put in place to follow policies and procedures, you don't have to panic that you're going to get slapped with a HIPAA fine, so don't be freaked out. We want to, it's a balance between making sure all of that information is kept private and being able to do your job and treat the patient and provide patient care. So you have to remember that when you're thinking about HIPAA, and don't panic about talking to treating providers about the patient's information and stuff like that. But it's really reasonable steps and reasonable efforts. So if you're doing the things that we talk about today, you're meeting that standard. You're not having to go above and beyond to meet those things. The minimum necessary standard, this was one of the biggest things that kind of came out with the privacy rule. And it's basically a risk management strategy. It says we're going to use or disclose the minimum amount of information about a patient that we need to do our job. So we're not, sending an entire record or an entire patient profile to a provider if they don't need it. So it's a risk management. We're not disclosing all this info that might be at stake if there's a hack or something like that. We're just giving people the information that they need to know to treat the patient. This was a case example just to kind of illustrate what is the minimum necessary standard. So 3 days after a patient was treated at the clinic, the nurse received the patient's path results from the lab. The nurse called the patient to report the results, but the patient didn't answer. The nurse left a voicemail on the telephone that detailed all of the medical conditions and treatment plan for this patient. So assuming the patient had authorized the nurse to contact her via telephone, the nurse violated the minimum necessary standard by leaving all this detailed info. So instead of just saying, hey, your lab results are back, or hey, your prescription is ready, come pick it up, whatever, they left all this stuff on the voicemail. So they would say that's a violation of the minimum necessary standard. The privacy rule protects PHI in all forms, so you have to kind of think about this in a very broad sense. Again, everything you're going to deal with in the pharmacy in your practice is going to be PHI in most instances. So you've got printed PHI, that's your daily schedules, check-in forms, any kind of written prescriptions. A lot of this stuff, paper's kind of disappearing, which is nice. But there are still paper faxes and stuff like that you have to deal with. The actual stickers you put on prescription bottles, that kind of stuff in paper is all PHI. Spoken PHI, so any telephone conversations or in-person conversations you have with the patient, that you have with other providers, with other staff members about the patient, all of that's PHI. And then electronic, and that's the big one now that everyone's worried about. So all of the records about your patient that are in that system electronically, emails that you might send, if you have any kind of things that you have to save electronically, files on CDs, DVDs, you probably won't have videos of patients, but anything like that, photographs of patients if you do research and come into contact with that, all of that stuff is PHI, so it has to be protected in line with the privacy rules. Printed, so what are our biggest potential HIPAA violations with printed PHI is that an unauthorized person can view it. So if you leave something laying around and an unauthorized person can see it, they can steal it. So it's someone's going to run off with it. Or they could copy it and use it for an unauthorized purpose. So what we really want to worry about when we're talking about printed PHI is making sure we don't leave it unattended in unsecured places. A lot of the pharmacies, you're a little bit better protected than some of our other providers because you're usually behind. There's not patients wandering around in your pharmacy. Now, if you're in clinical pharmacy, you may have these issues, but generally we don't have much problems with paper PHI for pharmacists. But just be thinking about that, making sure you keep paper PHI locked up. If you have to take notes about patients or something like that for something that you are doing, making sure you secure that information and don't leave it laying around. Spoken, your biggest potential HIPAA violations there are someone overhears it, or you tell it to the wrong person. So if the person that you're talking to is not the patient, but the patient hasn't authorized you to discuss their treatment and medications with them, that's a potential HIPAA violation there if you're having spoken PHI with somebody who's not authorized to hear it. So just making sure when you're talking about patient information, you're doing it in a secure location, or when you're discussing it, you're talking about it with people who are authorized to know. Yes?
About that, if you're in a retail pharmacy and your patient is hard of hearing and you're doing a consultation, everybody can hear everything you're saying.
And it's a difficult situation. I've had this issue before where people are worried. I think, again, it comes down to the reasonableness. If the patient, you have to kind of use the resources you have. If the patient is comfortable, then it's not normally a problem. I think if you have to give someone really sensitive results, you might want to offer them some kind of place you can move to the side. You can bring them in another location. It's not, depending on where you are, sometimes it's very difficult. But I think the regulations would look to, did you tell the patient, like, we have some sensitive things to discuss, like, do you want to go somewhere else, or do you want to, do you want me to send you a letter, or whatever. It's a reasonableness issue. It's something in a lot of places we can't avoid. So if you're not going to be, in huge trouble over that, I would caution you for, saying the patient's full name and any kind of, social security numbers or like very sensitive medication and diagnosis information, being careful about that. But it's really a reasonable, whatever you can do in the situation you're in, that's what they're going to look at if somebody was to complain. Does that make sense? Okay. Electronic. So this is the biggest source of PHI we have now, truly, is our electronic medical records, our electronic systems that house information, and then a lot of things that we send over the computer systems. So we just have to be careful about that. So the unauthorized people, again, can view it, or if you send it to the wrong person, if you send a fax to the wrong people, or if email to the wrong person, that's always kind of an issue for HIPAA. The big one is that we worry about people being able to get that information and alter it. So part of our reasonable efforts to protect information is to protect the integrity of that information. So we want to make sure it's not in locations where unauthorized people could take it, change it, and then give it back to us, and we may not know, which does happen sometimes when we've had these issues, not here, but with hacking. It's a big issue right now. So the easiest way to control the security and privacy for electronic health information is locking the computer screen when you are done using the EMR, wherever you are, locking it out. Anything that's done under your name and password is going to be associated to you. So that protects you, and it protects the patient's information. You really want to make sure you lock the computer screens, you log out of those systems, so that somebody doesn't do something under your name that you're held accountable for. Email, we'll talk about, if you all have to email patient health information, we'll talk about how you can do that securely. A big issue right now is texting, making sure you do not text identifiable health information. When you do that, and we'll talk about it under the security rule more specifically, but if you text, let's say you have Sprint, so whatever you texted, Sprint now has a copy of that patient's information, and then whoever you send it to, if they've got Verizon, Verizon now has a copy of that patient information. Neither of which of those people your patient's authorized to hear or to know that info. So making sure you don't text health information is a big one that we have issues with. Password encrypting files, we'll talk about how you can do that. And also just making sure CDs, DVDs, any flash drives, a lot of people really like flash drives now, anything like that is secured when you're not using it, so that patient information doesn't go missing and somebody can take it. Identifiable versus de-identifiable. HIPAA protects individually identifiable health information. So that makes sense. If you can't take the information and trace it to a person, then we're not worried about anybody's privacy because we don't know who they are. So if you think about it in terms of that, is the information identifiable? So HIPAA gives us 18 things that they consider, if any of these 18 items are accompanied by health information, they consider it PHI and identifiable. And some of them are obvious: names, date of birth, social security numbers. But some of them are kind of strange, like ages over 89. I guess they think there's not very many people alive over the age of 89. So if you tell someone's age over the age of 89, so if you said a 90-year-old white female has X diagnosis, that would be considered identifiable health information. Telephone numbers, fax numbers, email addresses, all these things that could be traced to a particular person. health plan beneficiary numbers, that's your insurance number, any kind of account numbers, certificate and license numbers, medical record numbers. That's what a lot of people like to use and say it's de-identified because it's not their name. It's still identifiable information under the law, so be careful. And it's not just of the patient. It could be the patient's person that lives in their household or family member. So you could say, if you were trying to not identify me, but you identified my mom, it would still identify me, which is weird. Or employer. So if you were trying to talk about, someone, a faculty member here, and you said, the faculty member who teaches this at ETSU, but without their name, you've identified them by identifying their employer under the law. It seems crazy. So just being careful. Most things are identifiable unless you strip everything on the screen off of there. So making sure you know what is and is not identifiable information is important. De-identified data. So if you have truly de-identified data, HIPAA does not protect it because, again, we're not worried about anyone's privacy if we can't figure out who it is. The law gives us two ways to de-identify information. One is the safe harbor method. That's the removal of all of those identifiers that we just looked at. The second is an expert determination. You are not considered an expert to determine that your own information is de-identified, so make sure you know that. We have to have it like an actual statistical analysis. So the best thing for you to do is if you've got to keep information that you want to de-identify, is make sure it doesn't have any of those 18 identifiers, and then you should be good to go. Access is the biggest area in which HIPAA violations occur. So in order to access PHI, you have to actually need that PHI to perform your job duties. You can't just be looking at random people's health information and say that it's covered because you have access to that system. Here's a case example. Recently, a court ordered Walgreens to pay $1.4 million to a customer whose PHI was inappropriately accessed and then disclosed by a pharmacy employee. The employee suspected her husband had contracted an STD from his mistress. The Walgreens employee accessed the mistress's medical records to confirm her suspicion and then shared the mistress's diagnosis with her husband. So even though she was authorized to have access to that pharmacy system, she wasn't authorized to look at this particular patient's information. She had no need to do that for her job. It was purely personal reason. So make sure whatever you're doing in these systems, when you're accessing health information about patients, that you have a job reason to be in there or an educational reason. So for the university, it's a little bit different than when you get into private practice. Part of your learning here is seeing other cases and looking at different things and comparing them. So if there's an educational purpose of your preceptor or whoever is saying, look at these 3 people and go through what's going on, that's perfectly fine. You're not running afoul of HIPAA there. It's really, we're looking at making sure people aren't snooping through health information for personal reasons. So don't panic about looking at people for not your job, but for education, it's fine. Again, access, this is a big problem, so we've had like 5 slides on here. Access to PHI, making sure you're only authorized to access the PHI when it's necessary to perform your job duties. If you are a patient of one of our own clinics that you might end up working in, you're not allowed to access your own health information in the electronic medical record. They run a report of that every week. I get a list of people who've done it on my desk every Monday. The reason for that is when you're given an electronic medical record sign-in, you have that ability to view, edit, create tasks, all kinds of stuff. So we don't want you to do that on your own record. It protects you truly from making sure that you don't edit anything on accident or do anything that's going to get you in trouble with your insurance company. But it's just a risk management strategy to make sure we are protecting your health information and we're not letting you get into it yourself. So don't access your own records. You can obviously access them through the patient portal, or if you want a copy of them like any other time we give patients copies, you can do it that way. You're also prohibited from accessing medical records of your family members. This is to make sure that we don't have any privacy violations. If your spouse or your child is is a patient in one of our clinics where you might work, or the pharmacy, wherever, you don't want to be looking at their records. You may or may not be authorized to actually see it. They may be getting a treatment that you're unaware of, that they haven't authorized you as a person to be on there. So just staying out of that protects everybody. Inappropriate access. So in the community hospital of San Bernardino, there was a hospital employee who accessed electronic PHI of 204 people without a clinical need for information. They fined her $250,000 personally. So that's not the university, that's you. So making sure you have a justification for the record you're looking at is very important. So that's $1,000 per record that she looked at. So this is a snooping case, basically, where some people complained that their records were being accessed by people they didn't know, and when they investigated, this one nurse had looked at 204 people. So making sure you have a reason to be accessing the information you're accessing is a big one. The privacy rule, another thing that it did was give us the ways in which we're allowed to use information and disclose it. So they break them into 3 categories. We have the permitted uses and disclosures, the required uses and disclosures, and then the ones that the patient authorizes us to do. Permitted uses and disclosures, the way that I always tell people to think about these are things that you've got to be able to use and disclose information for to do your job. It would be unrealistic for us to call the patient every time you needed to do something and ask them for their permission. So for treatment, if you need to call a provider and ask about a medication, you need to figure out something, you can always do that without asking the patient. It's a permitted disclosure and a use under HIPAA. For payment, you can talk to their insurance company if the insurance company is paying for the actual medication. And healthcare operations, that's things like training pharmacy staff, training providers, training all kinds of things like that. Quality improvement, you can use information about patients to do quality improvement activities. And all these are things you can do without actually asking the patient, because it would be crazy if we had to ask their permission every time you needed to talk to somebody about their treatment and figure out something. Does that make sense? Those are called TPO for short. Treatment, payment, and operations. The required uses and disclosures, these are things we're required to use or disclose health information for by law. In general, these 2 are the biggest categories, but there's a few others we'll talk about. You're required to disclose their patient's information to them themselves. State law in Tennessee says we have 10 days. So if they ask you for a pharmacy profile or they ask for a copy of their medication list or whatever, we have 10 business days to provide a copy. And we have to do that whether or not they owe us money or anything like that. They have a right to have their health information when they want it, and in Tennessee state law is 10 days for that. We're required to disclose information about a patient to the Secretary of the Department of Health and Human Services. DHHS is one of the HIPAA enforcement people, so if they ever ask a question and they're doing an investigation, we're required to turn over health information about a patient to them. So you don't have to get the patient's authorization to do that, you just do it. The other few that are required in response to a subpoena, specifically, subpoenas have to be valid. Sometimes we get providers who get a subpoena and it's not properly executed, so we wouldn't turn over the information. If you or any of your records ever get subpoenaed from ETSU, call our office and let us make sure that everything's in order before you turn anything over to anybody else's attorneys. To a public health authority, we're required to report certain communicable diseases and stuff like that. We don't have to get the patient's authorization, and in fact, even if they say they don't want us to report it, we're required to report certain diseases by state law, certain wounds and injuries that have to be reported to the police, and we can use and disclose health information to state agencies if there's a child or elder abuse situation that we're worried about. You can turn over information without worrying about being afoul of HIPAA. Authorized uses and disclosures, basically anything else you want the patient to sign an authorization form. From the pharmacy perspective, I think you guys usually will be sending information to other healthcare providers. That's never a problem. If it's somebody involved in the treatment of the patient, you can send their health information to that person. So as long as it's healthcare provider to healthcare provider, you're not usually going to need any form. If the patient calls and says, hey, send a medication list to my primary care doctor, not a problem. You don't have to get them to come sign a form or anything like that. So anything else, though, if they want to turn stuff over to an employer, they want to send stuff to their attorney, things like that, you want to get the signed authorization form because it protects you. So if something goes wrong later, they're not going to say, well, I didn't want my employer to know I was taking those 12 medicines. And you say, well, you signed this form, we did what you asked us to. So that protects you in the event something goes wrong and they want to know why we did that. The regulations give us some requirements for what is a valid authorization. So like simply writing, I want you to send this to my PCP is not good enough. Well, it would be fine for a healthcare provider, sorry. I want you to send this to my employer at ETSU would not be a valid authorization. It has to have very specific elements. Anywhere you work is going to have a form authorization that has all that stuff. So just making sure you use the right form is not a big deal. So here's just a little visual of the types of uses and disclosure. So the first ones we talked about are those things that are permitted. We don't have to ask the patient's permission. We just do it because it helps us run the business. So treatment, payment, healthcare operations. The required ones, we're going to give the patient their own information, and we're going to talk to the Secretary of HHS if we have to. And then we're going to turn stuff over to public health and law enforcement in appropriate times. And then anything else, basically, we want to make sure the patient signs that form to protect us before we disclose the info. When in doubt, call the office. If you ever have a question about whether something is appropriate, I take phone calls all day long. I'm happy to talk to you if you have a question about it. The biggest question we usually get is about research, and we'll talk about that and how you can use health information for research. But literally for anything, if you have a question, please call me or email me. I'm happy to talk to you about it before you take action. HIPAA and research data. So we do a lot of research at the university. I don't know when in the pharmacy curriculum if you're required to do student research, or if it's okay. So if you ever decide to take part on a research staff here doing research on patients, you have to just remember that you can't just use the information that's at your disposal to do research. You have to go through the IRB, the Institutional Review Board. They kind of review your study, make sure human subject protections are in place, and they'll tell you what kind of authorization you have to have for the patient. So you can't use identifiable patient information for research without getting that authorization form for the patient, because it doesn't fall into those categories that we talked about. They have to authorize you to use their info for research. So making sure you go through the IRB. If you do that, don't just take information out of the systems. That's just kind of reiterates the same thing. Making sure that if you're interested in conducting research, you contact the IRB before you take any information is always the best plan. For the privacy rule, another thing that it did is it gave the patient a notice of privacy practice. That's that 10-page document you get every time you go to a provider that no one reads. It basically notifies the patients of here's all your patient rights under federal law. So it tells them how we're going to use and disclose their information. It tells them in that, here for treatment, payment, and operations, we're not going to call and ask you. We're going to use your information to do our job. We might use your information to train other healthcare providers. We might use your information for quality improvement. Kind of gives the patient this information about what are we going to do. Then it also tells them what rights they have from the federal regulations. So they have a right to receive the notice that tells them how we're going to use it. We have to get them to sign something saying that they did get it. I'm sure everyone has experienced that themselves in healthcare. Some of the big rights that they have is a patient right to restrict. So they actually have the right to restrict the information that we send to different people. So that if they don't want their parents, this comes up with students a lot, they don't want their parents to get their health information, they can restrict what information is sent out. But for the most part, if they provide a restriction, we usually grant it if it's reasonable. If it's something we can't make happen, we have to let the patient know that. The only time we're required to grant a restriction is called the out-of-pocket restriction. This came out in, I think, 2013. And basically, the out-of-pocket restriction says that if I'm the patient and I come in to get service and I pay out-of-pocket at the time of my encounter, you're restricted from turning that information. Obviously, you're not going to send it to my insurance company for payment because I paid you, but you're restricted from sending that encounter to the insurance company. I'm not really sure I can think of why people would want to do it if they don't want their insurance company to know they have high blood pressure or something silly. I don't know. But it's something that the government feels like patients should have the right to keep information from the insurance company. The only time this doesn't apply is for people on TennCare, because that is something we have to turn over, that we only take cash payments for that after it's been denied from the insurance company. So a patient on TennCare doesn't get the same right because of the way that that's set up. But anyone else, if they pay at the time of service, they can restrict that all of the information that goes along with that encounter from going to their insurance company. It causes some problems for people. I don't know if it does at the pharmacy. I haven't heard anyone complain. But in general, because some of these EMR systems aren't set up very well for us to be easily flag documents and not go anywhere, and sometimes it comes up in that situation. But just being aware of that so you know that your patients have that right. The patient right to confidential communications. So they have the right to tell us where they want us to send the communication. Do we send it to their home address, to their work address? Can we call them on a cell phone, on their office phone, all that kind of stuff where they can tell us how they want to receive information. So the federal government says the patient should be able to choose those things. And again, if they're reasonable, we try and accommodate those requests. The right to access and copy. This is the one, truly the biggest thing that the government is worrying about right now, is making sure people have access to healthcare information. So that's the big move towards all this data sharing and healthcare exchanges is all kind of related to this. So we want the patients to have access to their information. We want their providers to have access immediately when they need it, to kind of just incentivize the free flow of health information among providers. So this is something we're moving to, but specifically the patient also has a right to get that information for themselves. We think that patients can make better healthcare decisions when they have their health information at their fingertips. So making sure that we don't ever keep someone's records from them is a big deal. They have the right to amend their healthcare record under HIPAA. Again, this usually comes up if we just make a mistake. We've misdocumented something, so they're asking us to amend the record. Obviously, if we did do something incorrectly, we will fix it. There are also times when patients just disagree with whatever we've documented. In that case, we wouldn't change the record. If we've done things correctly, we would just add they're allowed to write a letter of disapproval, basically, where it says, we have a form. I asked to amend my record, we denied it, here's why I think that, and then it just goes in the record. But patients do have the right to do that. They have a right to an accounting of disclosures, and this is how patients find out when other people are looking at their information or we inappropriately disclosed it. So you have a right to an accounting of disclosures. Anything that we send your information, we use it or disclose it besides TPO. Again, we're not having to document every time we talk to their provider and things like that. I mean, maybe you should if there's clinical significance. But we don't have to write it down in the accounting in the EMR for TPO reasons. But basically, if the patient requests this, we have to give them for a 6-year period. We have to tell them, here's the times that we used your disclosure information that weren't a TPO purpose. So that's like research. It gets documented in there. If you're sending it to their employer, that goes into the accounting disclosure. If you send it to their attorney, to somebody for disability purposes, things like that is what usually ends up in there. But for research, sometimes they actually waive HIPAA. The IRB will waive the HIPAA requirements, so we won't get your authorization to use your information, but it goes in the accounting. So the patient may not know, unless they ask for an accounting, whether their information has been used. That's pretty small circumstances under which the IRB waives HIPAA, but they do that sometimes. So those are things that show up in the accounting, and the government says they have a right to have that. Medical record retention. The Tennessee law for keeping medical records is a period of, it's generally 10 years from the last patient contact. This is kind of going out of style. Again, your EMR is forever, basically. So the electronic medical record is kind of keeping us from having to keep up with when we can destroy records, because we're basically keeping everything now. But you can, if you run a small practice and you have storage issues, 10 years from the last professional contact, except for certain records. Immunization records we keep forever. Incompetent patient records we keep forever. Minor patients we keep for 10 years, but it has to be at least 1 year after they reach majority, whichever is longer. Making sure that you don't throw records in the trash is a big one. There was actually in Hancock County a pharmacy where they had dumped all of the old recycled, like people would bring in, I guess they had some kind of program where they'd bring in their prescription bottles to be recycled, and they put those in an unlocked dumpster out back, and it actually got broken into. And so there was all these patients' prescription bottles and their medications, and you know everything that's on that label. And it was a big lawsuit in Hancock County here recently. So making sure we destroy things correctly. If you're in any of our clinics, anywhere, I think they do it a little bit differently, different places, but there's always some kind of secure destruction box that somebody picks up and shreds or something. So making sure you don't just leave stuff laying around, or if you take notes that you need to take home for a project or something like that, you're making sure you shred those, or otherwise make sure they're destroyed. Just not leaving things. There was a practice that closed and dumped all of their medical records in Steel Creek Park in Bristol. That was a big ordeal. People, I think it's just, I don't know what people are thinking, but just be careful when you are allowed to destroy the records. Making sure we actually destroy them and don't just throw them in the trash is very important. Okay, the security rule. The security rule is increasingly becoming more and more significant as all of the things are moving to electronic means, and as healthcare data is so sensitive and it's worth a lot of money on the black market right now. So the security rule is becoming very, very important because people are stealing healthcare information and they're selling it on the internet. So making sure that we are doing everything we can to make sure our systems are secured, and that we don't cause a breach of information is important. So the HIPAA security rule only applies to electronic info. You have to secure personal information when you're talking about it, but these are all actual secure technical requirements we're going to talk about now. So it only applies to electronic information. Emails, we'll talk about files that you save on computers, laptops, tablets, anything you might save on shared network drives here, obviously the entire medical record in electronic form, digital pictures, flash drives, DVDs, CDs, any kind of place you can think of where you're going to save something electronic that is going to include health information. The security rule is going to apply to that. Again, we're talking about reasonable and appropriate efforts. So for here, they break them up into administrative, technical, and physical safeguards. But again, if you're doing the things we talk about, you're meeting the standard. Don't panic that you have to, institute all these things on your own. So just making sure we're taking reasonable and appropriate efforts again. So the law requires us to safeguard the confidentiality, the integrity, and the availability of electronic PHI. So the confidentiality of it, again, that's the privacy portion. We're making sure it's not used and disclosed to people who aren't supposed to know that information. We're keeping it confidential. The integrity of electronic information is more difficult. In paper, it was a little bit easier to make sure information wasn't altered without our knowledge. So the integrity of PHI is a big deal, making sure that electronic information isn't altered or destroyed in a way that was unauthorized. And the availability, so we're required to make sure that PHI is available electronically and it's accessible to be used by the people who need to use it. So that's us and the patients, the insurance companies, people like that. So what is our biggest piece is we're required to identify and protect against anticipated threats. We have to protect ePHI from threats while we're using it, while we store it, and while we transmit it. Threats to ePHI while we're using it. Unauthorized access is the biggest threat to PHI while we're using it, is making sure that computer screens are locked. I had my insurance physical, they put me in a room, and I was sitting in there and the lady had logged into the EMR and left, and I could see the entire patient schedule for that whole day. So making sure if you're not on that computer using it, even, well, we're talking about access, even your fellow staff members aren't supposed to be looking at a bunch of people's information if they're not using it, they're not treating that person. So making sure you lock that computer and don't just leave it sitting on under your login is important. Making sure you password protect your devices if you access PHI from them. So if you use iPads in the pharmacy or in the clinic you're in, making sure they're passcoded and protected. Your phone, if you're going to send PHI via email, making sure your phone is password protected. ETSU, you all may have heard this, for the health sciences, we're actually starting, it'll be for you guys August 14th, so I think there should be a couple of emails that have gone out by now from Karen King. If you sync your cell phone or your tablet with the ETSU email, it will now force a passcode. For faculty and staff, it's always done that, but we are taking that step for students because there are being big concerns for breaches of health information. So if you're going to sync your phone or tablet with the ETSU email, if you don't want to have your phone passcoded, you just don't sync it with email. But that it will be actually force a password to help us meet that standard, because we do think that people have health information, university data, your own personal data is at stake at this point. So just making sure we password protect all of our devices that access PHI is very important. And then being aware of your surroundings when you're accessing ePHI, making sure you're not, using the electronic medical record on the weekend in Starbucks on unsecured Wi-Fi. Stuff like that happens all the time. So just making sure that we're protecting it when you're using it and not letting other people get to the information. Passwords, making sure you don't store your passwords so other people can access them. So don't put them on a Post-it note under your keyboard. Making sure you don't share your password with others. I think people don't worry about this because we trust our colleagues, but in reality, anything that happens under your name and password is going to be you who's responsible. So making sure you protect yourself. Don't share your logins and passwords to any of these systems so that you know what's going on with your login and password. Don't form your passwords from things we could find out about you on social media. If your favorite sports team is the Cubs and it's Cubs 1 2 3 4 exclamation, not a great password. So making sure you actually make a good password is important. The storage of EPHI, the best place that you can put any kind of health information is inside the medical record, inside your pharmacy system. Most systems are built with multiple layers of security. They're segregated from the rest of the computer system. So if it's in that system, in the pharmacy system, in the EMR, it's extra secure from if you're just saving it on your computer or you're accessing it somewhere else. So making sure it's in there is your best possible way to protect it. But if you have to if you have to store it somewhere else, making sure you do that securely. I'll show you guys on the website when we're done. If you need to store information in files on your computer or personal device or somewhere else, making sure that you password encrypt the file. So if you have Excel documents, Word documents, PDFs, you can actually encrypt each individual file. And then if your laptop goes missing, the PHI is not actually at stake because it's encrypted. The government has set a standard that says if we lose PHI, if it's not on an encrypted device or the file itself is not encrypted, it has to be reported to the government. So if you've got access to the electronic medical record and you've got files saved on your computer and your computer's not encrypted and those files aren't encrypted, we have to report it to the government. We also have to report it to your patient. Which is not good for you for your reputational and professionalism. You want to make sure your patient trusts you with their sensitive data. If you have to call them and tell them, hey, our system, I saved some files and they weren't encrypted and my laptop was stolen, and we have to report it to them, their patients aren't going to trust you. So making sure you protect yourself there too, as well as their information. So if you have a device that you're going to store PHI on, it's best to encrypt the entire device. But if you don't want to encrypt your entire device, you can encrypt it at the file level. And I'll tell you how to do that. So for storage of EPHI, what are our reasonable efforts there and safeguards is they're in the EMR or they're password encrypted. So no matter what happens, we've got them under lock and key as best as we possibly can. So if something does happen, we can tell the government, we securely stored them, we securely used them. This still happens. Sometimes breaches are inevitable, but we have to, that fine amount kind of goes to reasonableness, where we just, saving stuff on the worldwide internet in a Google Doc, the government's not going to be pleased. But if we've taken all these steps to safeguard the information and something still happens, it's not going to be as big of a penalty because we took the steps that we were supposed to take. If you password encrypt files on the file level, just a note, if you forget the password that unencrypts it, we can't do anything about it. That's the whole point of it being encrypted, is that you have to have that code to get into the document. So if you forget it, ITS can't bring it back. So making sure that you're aware of that. Transmission of EPHI. So this is a big issue of concern now because we have so many, we can get instant contact with so many people on cell phones, email, and all of that. Most of the EMR systems have direct messaging capabilities that, again, inside the system is the best, most secure place. But if you need to send emails, you can do that. For internal email communications, so if you're going to email from an etsu.edu to another etsu.edu address, excuse me, again, that's between two authorized people. We're not just sending PHI to whoever we want. All you have to do is put the word encrypt anywhere in the subject line of the email, and it will automatically encrypt your email. So you want to make sure the subject line doesn't have any PHI in it, so you wouldn't say like encrypt Lindsay Daniels seasonal allergies, whatever. You wouldn't include any info in the subject line, but everything else, the message and the attachment, are encrypted and secure in transmission and in storage. All you have to do is put the word encrypt, and that's it. So if you ever need to send something that contains PHI, making sure you do that. If you reply to an email or you forward it, as long as the word encrypt stays in there, that's all you have to do, and it's encrypted. For internal, You won't even know that it's encrypted otherwise than you see the word in the subject line. It's automatically set to decrypt as soon as it hits another internal inbox. So it looks exactly like normal email, except for you'll see the word encrypt, but you don't have to do anything to make it, to open the message or anything like that. Now for external email, if you're sending it from one of our email addresses to an external person, you still, same rule, put encrypt in the subject line, the secure, the email body is secure and the attachments are secure, but the person who receives it is going to have to set up a one-time code and it opens in a secure portal for them to access it. So it's a little bit more work for the recipient if you send it to an external email address, unlike internally where it just shows up and you can see it and it's no problem. But you can do it. So if you need to email somebody at Mountain States or wherever, you can do that. So here's an example. Again, just having the word encrypt in the subject line, and then I didn't include any PHI there, the PHI in the body and in the attachment if I had one. Any questions about how to use secure email? Okay. Now, email with patients. So that was all email with our healthcare team, right? Email with patients, we will send patients unencrypted email, but they have to consent to it, and it has to be in writing. The government thinks that we're in a better position to explain the security of the internet to our patients than the patients are themselves. So we have to actually tell them about the risks associated with email and sending sensitive data over the internet and things like that. But once they sign the form, you can send them unencrypted email. For all of our ETSU spaces, we have a specific form already. If you get to a clinic where you need that and they don't have a form, let me know. We'll get something for you. But just be aware, if you're going to send patient's email, there is a required consent in writing under HIPAA. So there's a little visual for you. So again, both of them, the rule for providers to providers internally and providers to providers externally is just encrypt in the subject line, no PHI in the subject, and everything's good to go. Email with patients, you're looking for a signed consent form, and then you're going to send them unencrypted information. Texting, again, we talked about earlier. SMS texting is unsecure. Everybody gets a copy of it. The sender's telephone company, the recipient's telephone company. So it's absolutely prohibited to send identifiable patient information via text. So making sure you don't do that. If you receive a text from a provider from anywhere and you're worried about it, let me know. I have had conversations with external providers who send our students information via text. So if you don't want to have that conversation, I'm happy to. You don't have to be involved or identified in any way. If you get information in a way that is unsecured and puts you at risk, please let me know and we'll take care of it. It's not usually our providers, but we have had issues before. So just making sure. We want to make sure you're protected and don't get info on your cell phone that you don't need. Okay, so we are required to implement safeguards that help identify threats to PHI. We have to actually protect against those threats is what the government says is our duty. The biggest threat right now to PHI is malware. If you've been watching the news, a lot of people are talking about ransomware, where it actually infects the computer, it can affect your EMR system, and it basically holds your patient's information hostage and demands that you pay them a certain amount of money to get the information back. This is happening nationwide. There's been hundreds of events. How the malware is getting onto people's devices is they're clicking on links in emails or opening attachments in emails, and it downloads the malware to the device. So we know that. We've identified that threat. So now you have to protect yourself against it in the patient's information by not clicking on links. Making sure that if you get a weird link, everyone on campus is getting phishing emails. IT is trying to combat against them, not as effectively as I would like. But there's ones that say like urgent. If you don't put in your password and name right now, your email address is going to be disconnected or your account's going to be shut down. Those are not real emails. No one from ETSU should ever ask you to input your username and password. You're never going to get asked that in an email. So if you get an email that says input your name, username, and password, it is a phishing email. And when you give those people your credentials, they are then using your credentials to log on to our systems, and then they spam other people and try and get those credentials back. I get a list of people who are compromised every day. So making sure that everybody's real click happy. We want to see our email real fast and see what's going on. Just making sure before you click a link in an email that you know it's from somebody that is supposed to be sending you something. There have been UPS ones recently where it's like, track your package, but if you didn't order something and it looks kind of wonky, don't click on the link. A good thing is either don't click on it, or the way you can really identify them is if you hover over the link. Usually if it's a bad link, like if it's a UPS link and you hover over it, it's going to say ups.com spelled correctly with a tracking number or whatever. When it's a phishing email, if you hover over the link, don't click it. If you hover over it, it's usually something weird scrambled out that's going to take you to the website that's going to download the malware. So just being careful about clicking on links is a big deal. If you do click on one, or you think your computer or your account has been compromised, IT needs to know immediately. The faster they know, the quicker they can take steps to shut down your account before A, it spams other people, but B, it uses your credentials to create havoc. So making sure that you're doing that. It's letting them know. Identifying phishing emails. Again, we're never going to ask for your passwords via email or your usernames. Your EMR vendors, now people are getting emails nationwide that appear to be from their vendors that are asking for their credentials to verify credentials and things. Nobody's ever going to ask for a username and password in an email. There's no legitimate reason to do that. So be careful about doing that. If it tells you you've won the lottery or free vacation, and click here. If it's sounds too good to be true, it probably is. There's usually a lot of misspellings in these. They have bad grammar. But the people are getting smarter, and some of the emails that come through look pretty legit now. So just being diligent about knowing, is this really something? If you have any question, just don't open it. You can forward it to the help desk, and they will actually, if it is a phishing email, they will actually search for that sender, and they can take it out of everyone's inbox. So you can save, other people by reporting one to ITS. They'll actually recoup it from the entire campus. So if it got sent to 100 people, they'll go ahead and get it out of everybody's inbox so no other people don't click on it too. So being sure that you're looking at emails before you click on them is a big way to protect information. A malware infection. The University of Washington, there was one physician's computer. He clicked on a link in an email and downloaded malware. It compromised an unknown amount of data. $750,000 settlement with the Office of Civil Rights. So OCR is who actually implements these civil fines. So this was a big deal. They're taking it very seriously because we house so many people's information. They really think that we, as providers, we've got to be diligent and we've got to protect that information. So just being aware. Again, sometimes breaches are inevitable. If something happens, we have to just start, mitigating the damages as soon as possible. But making sure that you're taking those reasonable steps, looking for emails, being on alert, not clicking on them, is what we ask you to do. Yes?
This might be considered a dumb question, but I'm not really technology
Sure.
savvy. But so say we're using our email, like our school email, and we have it set up for like our Wi-Fi that we pay for each month.
Sure.
We'll send our bill to that email so we see it.
Mm-hmm.
Just because we have them on that email, is it possible for them to hack into it?
Not generally. I mean, if you have your bill set up to come to your ETSU email, that's not a threat that I'm worried about.
Okay.
For legitimate companies, anyone can be hacked and can use their, legitimate email addresses to hack other people, but that's not normally how it's happening. It's generally happening by people who are specifically targeting us because of the value of healthcare data. They can sell healthcare data for, millions and millions of dollars. So they're trying to get healthcare data. So the likelihood of it happening through that, it could. Anybody could get their credentials taken, but that's not a particular concern.
Okay.
Any other questions? So how do we safeguard against this? Besides actually making sure we're looking at these emails before we click on them, making sure you have up-to-date antivirus software. If you're the person at the computer in the pharmacy where it keeps saying like, hey, update your stuff, don't keep clicking 3 hours later, go ahead and update the software when you can. A lot of the malware infections, if everyone would have updated their stuff, the patches would have already been on the device, and it would have guarded against getting the virus. So making sure you keep up-to-date antivirus on your devices. For your personal devices, I'll show you guys a little resource sheet about how you can get free antivirus software to make sure it's on your personal devices. But for ETSU devices, all of those get pushed information from ITS, but if we don't actually click the update, then we don't get the protection. Web browsing, so another way, again, people download malware to devices is through websites that have been corrupted. If you're going to be browsing the web to do things, making sure you close out the electronic medical record of the pharmacy system. Don't be in the system while you're surfing the web on websites that, for most of the things like training and educational stuff, like we have library resources and stuff like that, that's fine. But making sure you're not like checking all of your emails while you got that system up. You're not on Facebook or some of these other websites that often get compromised. So if the system is shut down and you're logged out, the way that most of the systems are set up, you access them remotely anyway. So if you're out of that system when the virus penetrates your device, the likelihood of it going into the actual EMR is less if you're not logged into the EMR. So if you've got to do a bunch of emails, you've got to surf the web or whatever, making sure that you're not logged into the EMR at the same time is a good safeguard for you so that it has a barrier between the two systems. EPHI and mobile devices. So mobile devices are a big threat because they're mobile. You've got health information at your fingertips and you're taking it a bunch of places. So making sure that all of your mobile devices are password protected. If you have personal laptops and tablets that you are going to keep PHI on, that you should encrypt those devices. But making sure we don't leave them unattended in places where someone can pick it up and walk off with it. If you use an iPhone or an iPad, if you turn on that Find My iPhone so you can remote wipe your device or you can track it, that's great. A good safeguard to have in place so that you can find that device if we need to, or you could, if you know there's PHI on it and it goes missing and you wipe it within a couple of hours, the risk to our information is pretty low. So that's just something that's nice to have for iPads and iPhones. I don't know that Android has a similar piece available right now or not. It does. Okay, wonderful. So making sure that stuff is turned on, that's always a good risk management situation. Laptops and iPads, making sure you don't leave them in your car. Everyone's like, well, I locked it in my truck. We have so many break-ins on campus and in the surrounding neighborhoods and just in the area of people getting their devices stolen out of their car. Obviously, if you're transporting the device in your car, that's fine, but we don't want you to leave it in your car overnight. Don't leave health information in your trunk while you're running around and your car sitting in a parking lot for a while. Just being careful with the information that you have. In Springfield, Missouri, there was a physical therapy center where one laptop was stolen from a provider's vehicle. It contained 148 patient files on there, $1.7 million. The reason this one is so high, again, is because the government does not think it's reasonable for you to carry around sensitive data and leave it in your car. They just don't think that's a reasonable thing, so they're really cracking down on that. So don't leave health information in your vehicle where it can be stolen. Removable media, avoid using external storage devices to store PHI for long term. If you've got flash drives that you need to transport encrypt files back and forth, the best thing to do is buy an encrypted flash drive. They're like $6 now. The cost of them is very cheap at this point. And if you lose that encrypted drive and it's got PHI on it, it's not great that you lost it, but we don't have to report it to the patient. We don't have to report it to the government because it was encrypted. So there's no risk to the information on it. So making sure if you're going to use portable media like that, if it's encrypted, is the best possible safeguard you can do. We don't want to store information on flash drives for long term just because they're easy to lose. Flash drives and computer systems that are ours, don't ever plug the patient's flash drive into one of our computers or anyone's computer anywhere. That's a way that you can get your system infected. We do get patients asking for that now. They want you to download their whole record to a flash drive. Most places, for our clinics, if you want a flash drive with their information, we'll let them have one of ours, a brand new one that's going to go in there, or if they brought one in the package, that'd be fine. But not plugging those in. Don't offer to let patients plug in their cell phone to our system to charge. These are all things that people that have happened. So just making sure that we're making reasonable steps to protect those systems. Don't plug in questionable devices to the system if you download something from. Even your personal devices are not a good idea. But plugging in anything to that system where all of that information is you're just putting it at risk. Disposal of data, making sure that when you have to if you've got information on your computer and you're going to sell it in a garage sale, making sure you actually wipe that device, not just delete the files into the recycling bin. It has to actually be wiped. If you need help with that, we have there's all kinds of open source software that will actually do like Department of Defense style wiping of your device. We can give you some directions on how to do that. Or ITS can also, we have a whole program for how that works. So if you ever have a device that you need to wipe, let my office know and we'll help you make sure you get that done correctly. HIPAA and social media, this is not usually a problem. Our students are usually very diligent about this. But making sure you don't post information about patients, again, that you think is de-identified, but maybe is not on the internet. Being very careful about that is important. That's one where I also think the government would say it's really unreasonable that you posted about your patient on Facebook. So don't put yourself in that situation. HIPAA violations. Normally we don't have a problem on campus. I think most everyone is really doing a great job about worrying about information and making sure it's protected. But if you ever have a question about whether or not something would be a violation of HIPAA, please ask me. Even if you think it's a stupid question, there are no stupid questions. I'm happy to talk about it. We put providers get put in very strange situations sometimes. So if there's something you have a question about, please let me know. This is just a list of the fines that the government has put out for right now. Again, if people are taking normal, reasonable steps, you don't have to worry about this. It's not. We haven't had anyone on campus ever have a HIPAA fine, so I don't anticipate we will. But just making sure that we're diligent and that we're being prudent about making sure things are in the right, being taken care of correctly. Criminal sanctions, there's one person in the nation who has been criminally incarcerated for HIPAA violation, and it was a nurse who was working, I think her husband or boyfriend was some kind of drug lord, and she was actually accessing the hospital system and looking at patients that were prescribed narcotics. She was then giving her boyfriend the addresses of the patients that were on narcotics, and then he was going to their homes and stealing their narcotics. I don't anticipate we will have anyone incarcerated for HIPAA violation, but be aware that is, you can be put in jail for it if you really are trying to really do bad things. If you ever have anything that you think, and it's not just a breach, if you think there's a system that's been compromised, the sooner I know about it, the faster we can start taking remedial measures to get our information protected. So if you ever think there's anything that we think has been compromised or there's been a breach of information, please let me know so I can help you figure out what to do in that situation. Or, if it's not you and it's someone else, we can figure out how to handle it. Lost or stolen devices. If you lose a device or it's stolen and it contains health information, again, making sure I know about it and ITS so we can make sure that if we have the capability to wipe the device, we do that and we get all of that documented so that if we do have an investigation by the government, we have all of our ducks in a row as to what we did to take the steps to make sure that information was protected is what is required. There's some resources for you, and I'm going to show you really fast. The HIPAA website has a lot of things on there. Email encryption, if you forget about how to do email encryption or you have a question, there's a whole document here that explains that with some graphics for people. It's easy to remember. Securing your personal device, there's also how to secure your personal device here that gives you some free antivirus. It will also tell you if you want to how to encrypt your personal device all for free. Those are some resources that ITS gave us, so those are nice to know. Training, so after today you all will all be HIPAA trained. Your stuff will go into the online system. You'll be able to print certificates. It'll probably be a week before those are available online for you to print, but I'll send an email to Dr. Crow so that you all are aware if they need to print those. Yes?
Is this through like our D2L, or where do we go to get to all of this?
Right here, this one link, when you click on this.
Like to get to the page you're on now, where would we start?
Oh, if you Google ETSU HIPAA,
okay,
it'll be there. You have to spell HIPAA correctly, 1 P, 2 A's, but it will take you there. And you can, and we're also, like if you go to the homepage of ETSU and hit the H the HIPAA compliance office is on there, so you can find it from that page. Any questions? Yes.
How often do they have to recertify?
It's once a year. So once we upload you into the online system, it'll be with today's date. So in 365 days, you'll get an email from the system that says, hey, your HIPAA's expired, please log in. For the second go-round, also I think Miss Debbie sends out some emails to students, so you'll get it from multiple avenues of reminding you. But you'll just log in and do it online. There's a little quiz online, and we keep that updated, so if there's any changes in the law, it'll be up to date online for you to look at. Anything else? Thank you all. Please give me a call if you need anything. All of my information is on the People Finder. Thank you. Thank you so much.
How's everybody feeling? You all want to take maybe a 5-minute break and run to the restroom real fast before we begin the next part? Yes? Okay, let's do that. 5 to 10 minutes and then we'll start back up. So it's 9 o'clock now, we'll start at 9:10. Thank you. Okay, I think we can go ahead and get started with the next portion of this. So just to introduce myself, I'm Dr. Crow. I'm the Director of Experiential Education. You'll be working with me throughout the year and in your summers for your experiential portion of the curriculum. The experiential portion of the curriculum is actually a third of the curriculum. So you have your entire 4th year with rotations, and then you have some rotations that we'll talk about in a few minutes that are scattered throughout your 1st through 3rd years. So we'll be working with you throughout your time here. So I want to talk about an overview of our IPPE requirements. And just to start, how many people know what IPPE actually is? You're going to hear this term thrown around a lot, IPPE, APPE. So what is IPPE?
Interpersonal or something. I don't remember the abbreviation, but it's when you go out and experimental rotations, whatever.
Good. So it stands for Introductory Pharmacy Practice Experience. And so the introductory portion of that happens your P1 through P3 years. So all of that is IPPE. You will have you'll have an IPPE course that has some components to it that Dr. Alexander will talk about later, with service learning and some other parts of that, our Cornerstone experience, which you'll hear about later. And then we have our summer IPPE experiences, and I just wanted to briefly introduce you to that. I don't know if you've heard about any of these IPPE experiences so far, but the summer following this year, so this coming summer, you will go on a 2-week IPPE community pharmacy experience. And so typically those will be within our region here. We'll talk about that a little bit later in the presentation as well. After your 2nd year, you'll have a 2-week introductory institutional pharmacy or inpatient pharmacy practice experience, and you'll also have a 1-week clinical pharmacy practice IPPE experience that will fall there too. So I just wanted to introduce you to that. And then your 4th year, you spend your entire year on experiential rotations. So you'll have 9 1-month-long rotations, and those are APPE. So APPE stands for Advanced Pharmacy Practice Experience. Just to cover, so first of all of these slides are being, and the whole presentation is being recorded, and so you'll have access not only to the slides but to the presentation that we'll put up on D2L for you if you want to review any of this later. So a couple of the IPPE success basics that I want to mention. First of all, check your email. So we don't have a lot of FaceTime with you with experiential education because we're not in your classrooms very much, but we communicate mainly through email. And so what we want you to do is check your email at least once a week. And actually that's a requirement. And especially as we approach October, when you have a lot of site requirements due and things like that, it's really, really important that you're checking that because you may miss some very important information about that. So check your email at least once a week. If you're on rotation, you need to check it daily. So again, stay on top of your email. Appropriate dress I'll talk about again in a few minutes. Attendance is required for all IPPE activities, for your rotations, for coursework, so just be aware of that. And then many of you, how many people in here moved in the past month? So almost everybody. So we have contact information from you, but I'm not sure that we have the most up-to-date contact information. Okay, Dr. Alexander, does that go through Wendy Williams? But yeah, I believe you need to update that information with Student Affairs, and I believe it's Wendy Williams up in Student Affairs. But we need to have the most up-to-date information from your cell phones, your addresses, and things like that, so that if we need to reach you, we can. So if you're, for example, if you're running late on a site requirement, we may send you a text. If we don't have your current cell phone number, you're not going to receive that message. And so that type of thing, that's why we need that information. So please update that as soon as you can. Yes?
When you get the updated information, we had forms in our orientation packets that we had to turn in.
Okay.
Do you get that through there, or do we need to do separately for you guys?
You don't need to do it separately for us. So if you updated it already, then it should be good. Okay, so to go a little bit more into the professional dress, I hear you all had some questions about what professional dress, business casual dress, and everything is. So we have a few slides here just to talk through what is appropriate to wear for business casual or professional wear. So you see the woman here on the left, and so you can for women you can wear suit jackets, cardigans, khaki pants, nice trousers, fingertip length skirt, or basic rule is just above the knees, not too short. And then flats or heels are acceptable for that as well. For the more professional wear, you should wear a suit jacket, business dress, keep colors not flashy or too bright or anything like that. And then skirts and dresses need to be at the knee, and then low heels are acceptable. All shoes, whether male or female, need to be closed-toed to be business casual or professional. So technically I'm not meeting business casual or professional right now because I have open-toed shoes on. But yes, so that's what our expectation is for females. For males, for the business casual, you can wear a collared polo shirt. You can wear a shirt without a tie, but a nice dress shirt needs to be tucked in. Have a belt. You need to have khaki pants or nice trousers on. Closed-toed shoes again. No sandals, of course. And you need to wear socks. That's an important component of that. And then for the more professional wear, you need to wear a suit or sports jacket. You need to, again, not wear too flashy colors. And then also have your dress shoes. So when in doubt, you need to dress conservatively. When you're going to your sites, so when you actually have your rotational experience, a lot of times they will have dress code requirements at those sites too. So we give you these basic guidelines. They may have more stringent guidelines than what we actually do. So you need to be aware of what they require for your dress. And then wrinkle-free too. So you can have the right clothes on, but if you're all wrinkled, you don't look very professional. So make sure that you are pressed and wrinkle-free. And then accessories. So your jewelry, your hair, your shoes, everything should be not too flashy. So hairstyles, you want neat and clean. If you have tattoos, you should cover up your tattoos. You don't want a lot of piercings, other than you can have piercings in your ears, but if you have piercings elsewhere, it can be considered not professional again, so you need to be aware of that now. And then wear a belt and a watch can make you look more professional. And so there's just some general guidelines on what you can do. And then here's another slide just looking at that again. So you see the business professional on the left and the business suit with the dressy closed-toed shoes, not flashy colors, and suit extending to the knees. And then you see your business casual. So it still looks nice with a nice blouse. Again, as a female, you don't want to cut too low. If you're wearing skirts, you still want them at the knee and not too short. You don't see bulky jewelry on either one of those. Their hair is very neat and appropriate, and not too flashy makeup or anything like that. And then for the business professional male, you see the business suit that fits well, so you don't want an ill-fitted suit again. And then business casual, which is really what you'll be doing most of the time for IPPE activities. So the business professional is just more for informational, but when we say IPPE attire, we're referring to the business casual attire. And most of your rotational sites will ask for business casual as well. And so again, males may be able to wear a polo shirt, or a shirt without a tie, or a shirt with a tie. But again, your sites may have specific requirements about what you might wear, so they may not think that a polo shirt is professional. And so make sure that you're checking their guidelines as well. And this just kind of reviews that. So you've got your do's on the left, so casual, polished, and then on the right, the shirt's untucked, clothes are wrinkled, the suit doesn't fit well, it's too short, and doesn't fit. And so those types of things are what that slide is trying to point out. And then for the females, you've got your business formal, your dressy business casual, and then your smart casual. But in all of those, the necklines, again, aren't too low, your skirts aren't too short, and you look very neat and polished and put together in all of those. And then the closed-toed shoes. Does anybody have any comments or questions about professional dress? I want to make sure that everyone's comfortable with what this means as we begin the year. Yes? For business professional, are heels required or flats acceptable? Flats are acceptable for professional. But again, our requirements are mostly the business casual, so you don't have to worry about the professional. So, but they're also acceptable for business casual.
Probably the only time you'll ever have to wear a suit, we do a career fair in October, and so as a second or third year student, you may have to wear a suit for that, but none of your rotations will you ever have to wear a suit.
Yes.
So on Friday, should we make sure we just wear closed-toed shoes for the ceremony? Is that considered?
Normally, they'll probably talk to you about it, but normally they aren't.
They're not as strict.
Pros wearing. We just want you to look good.
Yeah. Be careful with the skirts, though, because I guess just advice from me, you'll probably hear this too, but be careful not to wear too short of skirts to that, because they will be putting your jackets on you, and sometimes the skirts come up a little bit, and so you don't want that to happen to you. So just be aware that can happen, but business casual looking nice is fine for that, and I'm sure they will talk to you about that later.
For IPP attire in general, the reason we do closed-toed shoes is if you drop a syringe or you drop something that has a point on it, it's just basically a protection. So that's why a lot of sites will say they have to be closed-toed, because we don't want anybody to have a needle stick, which Dr. Crow is going to talk about in a little bit, but
yeah,
that's just generally why.
Any other questions? Yes. Mm-hmm.
Depending on where we go, like for the rotation sites, how would they inform us of what we're supposed to wear? Because I know that this is what we will mostly be doing, but I know that earlier in the week we had talked about some sites might want you to wear something different. Would that be via email?
Right. Okay. So that's a good question. So let me explain a little bit how we have information sessions, not just now, but we have information sessions throughout the year. And so we'll have an information session in October or November talking about how you put in your preferences for your rotations. So we'll talk about that then. And then right before you go out on rotations, we'll talk about this, like what your expectations are for when you actually go out on rotation for the summer. However, when one of our expectations, just to tell you, is that when you know your preceptor is 2 to 4 weeks before you go to the site, you send them an email and you ask for that type of information from them. So then if they have a specific dress policy, you can send out an email, ask them what their dress policy is. They should be able to forward you a document that tells you what it is, and so you're aware of it too. But always default to this, and then if their requirements are a little more stringent, you'll know from that. Anything else? Okay. So again, IPPE attire, you're going to hear that term used a lot. So you've got your business casual, you need to wear your lab jackets, which you'll get your lab jacket on Friday. You need to wear your ID that you see here, and then also any type of equipment that you need. So you see a stethoscope here, you need to have the appropriate things with you as well for that. Okay. I wanted to start talking about some requirements that you have for some of your sites, because some of these requirements are coming up due fairly soon. So Cornerstone, we have Dr. Gray coming, and he'll talk about Cornerstone a little bit, actually in a lot more detail. But Cornerstone is a assisted living facility here in Johnson City. You all will be spending some time at this assisted living facility each year, your P1 through your P3 years. And so they have some site requirements that you have to meet in order to go there. If you don't have your site requirements met by the deadlines, you can't go there, and then you fail the course. And so it's very important that you meet these deadlines by the timelines that we set for the course. So you all received this piece of paper. So if you'll pull this piece of paper out, these are the requirements that you have to meet. And there's a little circle that you can use as a checkbox at the start of each one of those requirements. You'll see at the top that your deadline for these are September 25th, unless another deadline has been set. We've worked really hard to keep our deadlines to be as close as possible to the same dates, because it gets confusing if you have 10 different dates of 10 different things that are due. So we're trying to make it as user-friendly as possible. For these, the confidentiality statements are the papers that I just handed out to you, or you received when you came in. At the end of that is the confidentiality statement, but the whole first part of it is the Cornerstone application. Has everyone filled that out? No. Can we just take maybe, do you think 5 minutes, and just everyone fill that out, and then pass them to the end of your aisles, and we'll pick those up. It's okay. Yeah. Just put in general. Yeah. Well, let me pause this. Integrity, and then. That I don't know the answer to.
I would check with Michelle Greenville on the second floor.
Yeah.
Her office is on this end of the building, and she can tell you how to make sure.
Okay. The next thing on here is your TB skin test, which I believe was a requirement for admission into the college. So we'll talk about how you can run a report in our computer system to make sure that all of those things are logged appropriately. So all of you should have that done, but you want to make sure and check that report just to make sure that all the information is where it needs to be. I will say that if you turn that in within the last few weeks, sometimes Student Affairs gets all of those things at once, and they may have a backlog of paperwork, so you may have turned it in, it just may not be showing up. So if you know that you've turned something in to Student Affairs, it would be good and it's not showing up, it would be good to check just to make sure that they have it just hasn't been logged. The next thing on here is the annual background check. Have you all already completed the background check for the college? So that then is your background check that you need. So you can check this off here. You don't need to do anything else from our standpoint. So we'll get a report from Student Affairs to tell us like if any of you haven't completed it, and then we'll follow up with you at that point. But as long as you know you've done it, then you can check it off. The next thing on the list is the influenza vaccine. So this is something that you have to do each year. We have specific information that we need from this flu vaccine that you see in this middle box. So if you go to CVS, for example, and get a flu vaccine, sometimes they print you a label that has all of this information on it. But we need basically your name, the flu vaccine name and strain, expiration date, name and address of the place where you received it. So if you receive it at your doctor's office, just make sure that all of that information is on there. I just received a text this morning that I believe Rite Aid in Elizabethton is already offering the current flu vaccine, and so it is something that you can go ahead and take care of now. And if you can, I would recommend just going ahead and doing that, because right now you're in orientation, you're not having a lot of other worries with coursework, so the more things you can get done sooner the better. But it does need to be the 2017 strain. Yes?
Places that do it for no cost?
I don't know of any places that do it for no cost. We do have a vaccine day here at the school at some point, and I don't think that date's been scheduled yet, but we do offer it here at the school too.
Pharmacy
But-
will do it for free. I mean,
Yeah,
you got
right.
arthritis, they'll bill your insurance and stuff.
Bill your insurance, okay.
Yeah.
It just depends on your insurance.
Yeah, it depends on what your insurance is. So, I believe the flu vaccine clinic here, we don't bill insurance, so there is a charge for doing that, right?
It depends on who hosts it, but I usually can host it $25.
Okay.
So it's like,
Okay. Again, we need proof of that vaccine in the Office of Experiential Education. So your compliance with this whole checklist is not just doing it, but making sure that all of the information is where it needs to be, so that we know that you've actually done it. So when you get that label from CVS or wherever you go, or any type of documentation, you need to bring a copy of that to our office. Or you can scan it and email it. However you want to do it, just make sure that we have a copy so that we can log it for you. The next thing on the list is a 10-panel urine drug screen. it's very important that you note the dates on here in that left-hand box. So Cornerstone has a requirement that you complete this within 30 days of being at the site. So you're going to be at the site in early October. We don't want you to complete it because of that any earlier than September 11th and no later than September 25th. So you have a couple of weeks time frame to get that done. We have a couple of sites listed in the middle part where you can get, we know that they offer the 10-panel urine drug screen, which by the way, it does need to be a 10-panel. If you get a different panel, it doesn't count for this requirement and you'll have to repeat it. So make sure if you're getting this done at your doctor's office that you're actually getting a 10-panel urine drug screen. Again, we have a couple of places here in the middle box where you can get those done. So the main campus Student Health Center will do it. It costs $41 there to get it done. If you are on any medications that you think might pose a problem with your urine drug screen, I wouldn't advise going there because they won't reconcile it with your med list. And so if you know you have a medication or you think you might have a medication that might interfere with this urine drug screen, I recommend going to Wellmont, which is the next place on here listed. And the cost there is $53, but they will reconcile your list. The hours are listed here for both clinics. So the main campus Student Health Center is 8 to 4:30. Wellmont is 8 to 7 p.m. And 10 a.m. to 5 p.m. So I sent out a document yesterday, an email about the Wellmont urine drug screen requirements. Their hours are actually until 8 p.m. until 6 p.m., but they want you to come at least an hour before they close so they have time to run the screening and everything. And so the time frames you see here are different than what you got in your email, but these are the hours we want you to show up at the clinic, no later than 7 p.m. or no later than 5 p.m. on the weekends. And then the address is listed there for the Wellmont Center. And then we need notification that you passed it. We don't want to see all of the things that show up on your urine drug screen. We want to know that you actually passed the urine drug screen. And so we have our fax number here. They can fax us. Those two places are familiar with faxing us your report, so they'll just fax us a report that says you passed or failed. You'll probably get more of a printout of the exact specifics of your urine drug screen. We don't want that. We don't want that type of information in our office. So make sure when you go there that you give them our fax number so that they'll fax us your results. I will say that all three classes, so there are about 80 of you in here, there are about 80 of you in the P2 class and the P3 class, everyone has the same deadline. So my recommendation is don't wait until September 25th to get this done. Another thing that happened last year is our Wellmont facility ran out of tests because we sent them so many students. And so again, make sure you're planning ahead. And so what I would do if I were you is I'd set a reminder in my phone right now for September 11th and start thinking about that deadline right now. I know it's still a few weeks away, making sure that you get that done on time so that you can do that Cornerstone experience.
You can't do it early.
Can't do it early. So I would set a reminder for September 11th so that you know. We did have a few students do it early last year, and technically those, for the Cornerstone requirements, those drug screens don't count. And so, yeah, so you need to do it within that September 11th to September 25th deadline. Any questions about any one of those things? So all of these things are requirements for you to go to Cornerstone this fall, which again you'll do in October. These are your expectations for you and your responsibility to get done. It's not necessarily on Experiential Education's responsibility to make sure you get those things done. So you have this checklist. You need to stick to the checklist and make sure that you're getting everything you need done by the deadlines. The last thing on here is a professionalism contract. We will talk about the professionalism expectations for IPPE later on. Hopefully we'll be able to go ahead and sign that within our computer system today. So hopefully by the end of the day you'll also have that requirement done. If not, we will at least talk you through how you sign that contract. You also receive that contract in email, so you have a PDF version in your email that you can review, but we'll talk about it in a few minutes. And again, failure to meet the deadlines can result in failure of the course, and for the most part your deadline is September 25th except for OSHA, and you'll receive an email that will give you a deadline for OSHA. So next I want to talk about our eValue system, which is our experiential education computer system that we use for a variety of things. So we can use it for your evaluations from your actual rotations that you have in the summertime. We may use it to show us if you've completed your site requirements. So there'll be a report that we'll talk about here in a minute that shows some of our policies. So our needle stick policy and other policies are listed on the home page of eValue. So there are multiple things. You don't need to know all the details of eValue now. You just need to know that it's a computer system that you can use to do these types of things. So I have instructions here on how to pull your INC report. So everybody brought their laptops, right? You should have received an email with your username and password for eValue last night, I believe. Did everybody receive an email? Yes. You may not be. Yeah. What is your name?
Stephanie Dye.
Okay. If not, we'll send it to you.
I couldn't find it.
You couldn't? You got it.
Sorry, I was trying to think because they've been sending stuff in like my undergrad email. It's like some books and some undergrad email to me and some of it's in my kids' email. So I don't know how to get this all transferred to you.
So it looks like no one got the username and password in the email. Is that correct? Yeah. You have questions? Okay, so the next slides, if you can't get into eValue right now, you can't access this information. And so these slides will be posted, and so that when you can get into eValue, you should be able to access your personal records report. But once you pull up eValue, you'll get a home screen, and then you'll go to other tasks, which you see marked there, and then manage personal records. And this report tells us if your site requirements have been met or not. So if you look, it's not very big writing here, but if you look, this says not met and met. And so you'll know exactly what you need to do based on this, and you can monitor your own progress. So again, a lot of you said that you turned in your TV test results. This is a place that you can go and just make sure that it's actually posted into the system and that we have it on file. So again, if you have any issues, since we can't do this today, if you have any issues with this, please let us know, and we can help you pull those reports too. And then the next couple of slides are just about printing that report. So if for some reason you want to print the report, there's some informational slides in here as well on how to print that. But I'm going to skip through those slides for now. Okay. What I'm also going to do is we have another thing that we're going to do in eValue here later on. So we'll try to get those passwords to you before that next session of our orientation so that you can at least be on eValue for that part. So the next part I wanted to talk about is our needle stick policy. So all of you will be going through vaccination training sometime soon. I don't know what the exact dates are. You may be giving vaccinations. Do you know the date?
Yeah, they're end of September.
End of September. We'll have some service learning opportunities where you may be going to various places and giving vaccinations. And so we wanted to talk about our needle stick policy just to make you aware. First of all, I want to make you aware that this can happen to anybody. It's not something that you should be afraid to tell people about. It happened to me just a couple of years ago, and I've been in practice for 10 years, so it's not a matter of inexperience. It can happen to anyone at any time, and it's really important, if it does happen to you, that you report it immediately and to the appropriate people. And those appropriate people include me in the Office of Experiential Education, but also if you're at a particular site, you need to report it there, because they may have some different forms for you to fill out, incident reports, and have their own procedures that they follow. But you need to make sure that both of us, both offices know, or both places know. So what types of body fluids we're talking about would be blood, semen, cerebrospinal fluid, and things like that. Things like feces, vomit, urine are not typically fluids that we worry about exposure to, but if you have exposure to one of the fluids that I mentioned, first of all, you need to wash with soap and water. You need to flush any splashes to your nose, mouth, or skin. You need to irrigate your eyes, and then you need to report the incident. And then you need to seek medical treatment immediately. So don't wait 24 hours. If someone is, if you're exposed to someone that is a high-risk patient, as I was, you may need to start post-exposure prophylaxis within a few hours. So it's not something you want to sit on and wait. You need to address it immediately. And your preceptor or site employee will inform the patient and consent the patient for testing. So again, you don't want to wait and tell them a month down the road. You want to tell them while the patient is still in the office, so that they can go ahead and test the patient and make sure that the patient isn't positive for something like HIV. So report that immediately to your preceptor and to the experiential site. You need to fill out incident reports. So again, you'll probably have an incident report for ETSU, one for the site wherever you are, and then that report needs to come to our office within 24 hours of the incident. Again, this is what your eValue homepage looks like. As part of eValue, you will have access to pharmacist letters. So you see this red arrow down here. You should also receive an email with username and password information for a pharmacist letter, but you do have access to it through eValue. And this is what your online access to pharmacist letter will look like. So the next thing I want to talk about is our Office of Experiential Education policy. So we have a number of policies about things, including the site requirements that we just talked about and what happens if you don't meet those site requirements. All of those things will be included in the student handbook as an appendix at the end of the handbook. So I think you've already had a discussion about the handbook. This section of the policies will be in an appendix in the handbook. I'm not going to talk about every detail in there because it's about 20 pages in single space, so I can't go through every detail. So I want you to go out and read through those policies at some point during the semester. But we'll talk about some of the highlights and how they affect you in the near future. So you're going to hear us using several terms like active site, new site, out of region sites from our office, and I just want to make sure you understand what those things mean. So an active site is one that has a current affiliation agreement, which an affiliation agreement is a legal contract. For every site that we have for experiential education, we have to have a legal contract with them about having you at their site. And so those legal contracts can take several months to even up to a year for us to obtain. And so that's why we have set some of the rules that we've set on timing of when you turn in your paperwork to us, for example, and things like that. A new site is one that doesn't have that affiliation agreement or that legal contract. So once you inform us that you want that site, we have to pursue that legal contract with them. And again, that can take months for us to achieve. And then out of region site, which on the next slide, out of region sites, the way we have it classified, we do have the paperwork, or we do have the affiliation agreement, but they're not located within the Tri-Cities region. So when we come closer to October, when we're asking you and preparing you to put in your preferences into this eValue system for what rotations you want for the following summer, so we'll do that in November. You'll put in those preferences. We'll have a session where we talk about how you enter those preferences before you actually have to do that. But we don't routinely contact these out-of-region sites to know when the preceptor wants to have students, so they'll send us information about which months they're available to take students, and we don't typically do those for those out-of-region sites. So on your Facebook page, over the summer, we posted a document that had, or access to a document that had all of those out-of-region sites. If any of those sites in that document are sites that you might be interested in for rotations, there's a form that will have you fill out in experiential education. So you need to come and talk to us and let us know, and then we'll contact them for capacity. Yes?
The email that was sent out, I believe it was sent out in July, but the deadline for it's August 31st.
Yeah.
Since we're waiting until October, do we still need to take
Yes.
action with that?
You do. So I'll talk about the deadlines here in a few minutes, but I believe in the policy, the deadline is September 15th, but if you're pursuing a site, you need to get it really honestly before August 31st so that we have all the information and everything together and in the computer system before we have you start filling in those preferences. And all of that stuff takes time. So again, that's why we're asking for that. So our areas considered in region, so when I was talking about out of region, it's anything that typically doesn't fall within this area. So it's a 1.5 hour drive from the Gatton College of Pharmacy. We have areas in Virginia, so Abingdon, Bristol, but most of those are within an hour drive actually. So Greenville, Johnson City, Jonesboro, Kingsport, Mountain City. So those are our in-region areas. So if you are planning to establish a new site, again, if it's not on that out-of-region site and it's not one of our active sites, then we'll have to set up a new site for you, which means we have to pursue those legal contracts and everything. So again, we need as much time as possible to set that up because it may take months. And so even if we're initiating it now, we may not have the paperwork together by the time that you need to enter your preferences, and the site won't be available. So if you need that, you need to talk to us as soon as possible so that we can start pursuing that. But for those sites, first of all, we don't want you to have any conflicts of interest. So if it's a site where your family member works, a close family member, your spouse maybe, it won't be a good site for you to do your rotation. If you work at that site currently, you can't do your rotation at the site. And then you can't be paid for this experience either. So if you're there for 2 weeks for IPPE training, it's a non-paid experience for you. Yeah.
For rotations, I've got a sister here as well, and she'll be doing rotations. Could we both do rotations at the same pharmacy?
Yes.
Okay.
Yeah, you can do them both you can both do them at the same pharmacy. Yeah. For us, from our standpoint, what we need when we establish a new site is we need that legal contract first. Then we have to enroll preceptors or onboard preceptors, which it requires applications. It requires also getting what months they're available, which we call capacity collection. And then we have to approve the site and the preceptor once we have all that information to precept you as a student and make sure that they're meeting all of the requirements that we have. So again, when we say August 31st, all of these steps have to happen between August 31st and November. So that's why we're asking for that deadline. Again, for out-of-region sites, there are already active sites if they're on that spreadsheet, but we'll still need to contact them and figure out which months they want students. And so, if you received an email, you said with the spreadsheet in it, if you can't find that email or you need it resent to you, please let us know in our office and we'll resend it to you so you can see those sites. So just highlights for our new practice sites policy. First of all, we want to make sure preceptors are willing to take students on an ongoing basis. If we go through this months-long process of onboarding a site, we don't want them to only take you and never take students again. So that's one of the things we're looking at. We want to make sure all of that paperwork that we need, so those 4 steps that I talked about, all that needs to be in place before November when you start entering preferences. If all of that's not in place by the time that opens for you to enter your preferences, site's not going to be in there and it's not going to be available for you. This next point applies mostly to your APPEs, but we want to restrict you to one geographic region only. So we've had students in the past for APPEs want to go to California for one, and then Utah, and then Florida. And so we want to make sure that we're establishing the sites within one region. And then again, the completed site paperwork is necessary. It's so important that I put it in there twice. And so you need to make sure, or we need to make sure as an office before we let you sign up, I guess, to take a rotation at that site that we have everything that we need. And so for your new practice sites, we do have a maximum number of requests that you can turn in. Not every request is going to result in an active rotation, so you still can end up having a rotation in the Tri-Cities region even though you're filling out a new practice site form, if for whatever reason the paperwork isn't together. So it's very possible that you may end up with a rotation within the Tri-Cities region if all of that paperwork doesn't come together. So for your P1, you can put in one new site request for your community pharmacy IPPE, and that deadline that I have listed here is September 15th. But however, the sooner we get it, the better. For your P2 institutional IPPE, again, you can put in one. So you'll do a 2-week rotation in the summer following your P2 year. And if you look at that deadline's much earlier than that September 15th. We're giving you till September 15th because you're new and you're just starting and you haven't had the opportunity to meet these early deadlines. So if you are thinking that you might want to do something like that, the paperwork needs to be in by the time you finish your P1 year, already for your P2 institutional rotation. And so we have the deadline set for April 30th of your P1 year. So if you're thinking about it, you need to start thinking about that now. Those institutional contracts take much longer for us to get than your typical community contract. So that's why the deadline is early there. And then for APPE rotations, you can fill out three new site requests for sites. Yes?
So when can we expect to see a list of the institutional in-region sites or something like that?
So there's a spreadsheet list that we have, and that, again, will be on that out-of-region site availability. And then I believe there's a spreadsheet with all of our in-region active sites too. If you have any questions about that though, we're in on the 3rd floor in room 301. So if you go up the steps, we're to the right on the 3rd floor above the porch basically. So you can come in there and ask us questions about that. And again, for your APPE rotations, you can fill out 3 new site requests. The deadline is April 30th of your spring semester, so your P2 year. For our out-of-region requests, basically everything fits the same requirements. So your expenses are the responsibility of the student. You shouldn't expect housing no matter where you are, whether you're in the in-region or out-of-region, or transportation costs. You can fill out the same number of requests, so you can do one request for an out-of-region rotation. And again, we have different applications for those things, so we'll send those out in an email. And so we also have an APPE, IPPE rotations policy. And so one of the things that happens sometimes is we have students that say, oh, I need to only be in Johnson City because my car's not very reliable. So by the time you reach your rotations, we need you to have reliable transportation because we can't guarantee that all of your rotations will be in Johnson City or even that your community or institutional rotation will fall within the Johnson City area. So you need to have reliable transportation. Any expenses that you have, again, are the responsibility of the student. The next one applies mostly to APPE, so I'll skip over that for now. But if you're doing, well, I'll just say real quick. So if you're doing a community rotation, so community general rotation, you can't do a compounding rotation at the same site or an advanced community rotation at the same site. So that's basically what that means. It only applies to your P4 year. And then the rest of these, I think, apply mainly to your P4 year. But in those policies, we do have guidelines on. So we want you to contact the sites, but we want you to have very limited contact with the sites. So if you need to contact the site, there are specific guidelines in the policy that say, here's what you need to do, here's what you're allowed to do, and what you're not allowed to do, because we've definitely had sites complain to us that students inappropriately contacted them to set up a site, and what that means is we'll deny your request for the site if that happens. So there are sample emails in the policy that say here's what you can say if you're contacting a site in the policy. So again, if you're doing this, please refer to the policy. Once we have your schedule set, so we'll have you put in your preferences in November. You should get your actual schedule probably late January, early February. When you have your schedule, we'll have a period of what we call open swap. So you'll have a week's worth of time that you can switch out of your rotation if it's not something that you wanted. And then once that happens, you can't change your schedule for just any reason. So if you decide later, I don't want to go there, I want to go somewhere else, we're not going to change that for you more than likely unless it's an extenuating circumstance. And again, the policies will set rules governing communication. So I talked to you about emails. You need to check your email weekly, while not on rotation, daily while you are. And it'll set rules for evaluations. So you'll fill out evaluations of your site and preceptors, and then also site requirements. Okay, so some highlights of compliance-related issues. So when we talked about this checklist, this is compliance. You have to meet all of these requirements before you can go to Cornerstone. If you don't meet those requirements either for this or for any of your community sites that you have this summer, you will first of all be reported to the Professionalism Committee. So you talked about that, I believe, a few days ago. For your APPE experiences, so your 4th year, you'll receive actual grades. So you can have point deductions on your grade for not meeting those requirements that they have for you in time. If you are on IPPE, it's a pass-fail course for your summer rotations. So your rotation can be canceled, or you can fail the course for the summer. And so it's important that you meet those requirements. And again, we talked about you can request one site. You should have minimum contacts with the sites. Your deadlines we talked about already. And this kind of just runs through a quick timeline. So again, most of your requirements are going to be due on September 25th. We will have you put in your preferences of what rotations you want for the following summer in November. So your dates are there. We call that whole process the spin. So the spin will happen for you from November 6th through the 14th. We will have an orientation session before that happens. So we'll have another time frame where we're telling you how to enter those preferences in November. You should receive your assignments late January, early February, and then we'll have that open swap period for 1 week following those assignments. And with that, I am finished talking about introduction to IPPE, and I will turn it over to Dr. Alexander, but I think she stepped out of the room for a few minutes. So if you want to take maybe 5 minutes again and take a quick break, we'll visit.
Helps with how you answer questions that providers have, how you present medical information, how you dissect it, interpret it, and apply it. So that's the simulation piece. The patient care piece takes place at Cornerstone, which Dr. Crow kind of talked around. So the Cornerstone experience is at a local senior center. That's a senior living facility. It's not a nursing home. It's actually independent or assisted living, which means people are ambulatory. They're moving around. They drive. And basically, you will be paired with a resident, and you'll see that resident through for your whole 3 years. And when I say you, it's you in a group. So you and your learning groups will have a resident. Dr. Gray is going to come in and talk about that here in a little bit. But that experience looks fairly similar year to year. And then the service piece is you going out into the community to do some beneficial medical-related services. And we'll talk more about that too. So it's pretty consistent year in, year out. Anybody have any questions about what this looks like or how things fit? The rotations, we'll have a session for that later on, but you get to pick kind of the blocks of time preference-wise. You get to pick the location preference-wise. So you have a lot of flexibility and some choice on where those things happen and when they happen in the summer. But they are 2 weeks at the community pharmacy, 2 weeks at an institutional location, so at a hospital, and 1 week with a faculty member at a clinical site, so a rounded team. So it would be one of our faculty that work in either clinic or a hospital setting, not community settings. Okay. I'm trying to think. Oh, a lot of people ask, can I test out? So we had so many people that said, they have experience in community pharmacy. Can I just test out of the simulation or can test out of the rotation? And the answer is no. So the accreditors say that for the introductory pharmacy practice curriculum at any college of pharmacy, you have to have at least 300 hours of IPPE experience. And so to make sure that we hit that benchmark, testing out doesn't work, and also just to make sure that we have everybody's skills at a certain level that we can sort of put our stamp of approval on, we have to have you go through the experiences. So unfortunately, there is no testing out. So the goals for the P1 year, this is what I want to have you guys be able to do by April. I want you to have at least technician, if you haven't had experience, or intern or pre-pharmacist level skills in a community setting. And we are going to focus more on the dispensing side, since that's where your rotation is. We're trying to get you to have improved communication skills, so I want you to be really good communicators with both patients and other providers. We're hoping that you'll grow and develop as a future pharmacy practitioner. And then also we're looking for progress, not perfection. So I understand, especially if you don't have experience, that it takes a while. It takes some practice to get good at these things. And so we're just looking for you to improve. We're not expecting you to be perfect. So keep that in mind when you're looking at the class. Okay, so we're going to go through a quick overview of the longitudinal IPPE syllabus. I'll show you the D2L site, which you all now have access to. I think Academic Affairs comes in, is it this afternoon or tomorrow? Somebody got their calendar out. So they probably are going to show you how to log on to D2L if they haven't already. D2L is our learning platform. It's where all your courses will be housed, all the information for your courses. And IPPE has a course site in D2L as well. It's similar to Blackboard or other learning platforms that you probably have had as an undergrad. We'll talk through the schedule. Dr. Crow already mentioned attire considerations. And then just to point out, this is a pass-fail course. So everything is evaluated on a pass-fail basis. That's why I said we're looking for progress, not perfection. And the bar for passing is different depending on the skill. So we'll kind of talk about what that looks like. And it all surrounds these kind of 3 key areas. So let's start with simulation. That's the one I coordinate. I have 2 things I coordinate in this course. So I already mentioned it's community-based. You'll go through 4 different visits. And if you are not in the P2 year, this is going to look slightly different, and we'll cover this next week some point. But for P1s, you're going to go through 4 visits, 2 in the fall and 2 in the spring. They're 2-hour apiece, and there's some pre-work that you'll be required to do. So make sure that you give yourself some lead time to get that done prior to whenever you're scheduled. Because there's some readings, there's some videos you may have to watch depending on whatever skill we're looking at that day. So make sure you take care of that. They'll occur in the compounding lab in the basement, so right below us here. We do ask for IPPE attire. So professional dress, white coat, name badge. You don't have to bring a stethoscope because we're not doing anything with that. Just a point of clarification, we'll talk about IPPE attire in class too. So in CPOP, there's actually a dress code and they require IPPE attire. It's not an IPPE course, it's a didactic course. I coordinate a lab in the 2nd year and we require IPPE attire sometimes too. So we use it real broadly sometimes, but it's always consistent what we mean. So let's go on D2L here quick and look at kind of breaking this down a little more. So here's the D2L page. I use the news feed pretty often. Dr. Welch put something fun in there. But here it is. So if you go under content, that's where all of the information is housed. And go under general course documents, and you'll see the syllabus. The syllabus is long, so when you open it up, don't be surprised. It's a big document. It's just because there's a lot of things that go on in this course. Dr. Crow and her office staff are listed on the syllabus, but more than likely if you have a question related to the longitudinal IPPE course, the stuff that happens during the school year, just come to me, because more than likely I'm the person that'll know what's going on. And my office is not in the same wing as her. Okay. Found a hiccup already. It says you have to be enrolled in the P2 course. That's not true. Alright, okay. So, let's just skip all the stuff that you don't care about, the objectives and the outcomes, and we'll just go straight to the good stuff. Right? You guys never read that. I write it, but you never read it. So, and it is hot in here. The activities overview. So, you're already doing number 1, which is orientation. So, we give you an orientation to the longitudinal IPPE course. You can see here that simulation is broken down, so that's that community simulation with the 2 in the fall, 2 in the spring component. And I kind of give you an estimated time over on the far right-hand side. So I say roughly 8 hours of prep time, which is about 2 hours per experience. So expect to spend about 2 hours getting ready for every visit you have. And that's all counted towards your total IPPE hour time. So we count that in with the 300 hours that's required. The patient care experience Dr. Gray is going to talk about, but you'll have a visit in the fall, a visit in the spring, and then there's a couple assignments that go with that, and there is an orientation that P1s have to do to the site, and it's the only time you'll ever have to do it again, so it's a one-time thing. And then the service requirement, which we'll get into. There's some other things that happen. Dr. Crow mentioned Experiential is kind of odd because there is no dedicated, there's time on your schedule, but there's no class time. We don't meet every week. We just kind of meet as scheduled. And so that's a little different. So a lot of our communication comes out via email or on the D2L page. So please make sure you're checking your email. If the office sends you something, or if our secretary, Debbie Frakes, sends something, that's probably the only way you're going to hear about it. So we do a spin session. Spin is where we come up with how your rotations are going to be next spring. So that's important. That's going to go through how you rank, your timing, and your location of that rotation. And then in the spring, we do a pre-rotation orientation, basically tell you what to expect when you go out. And I've got the community rotation list down there. It's a pass-fail course, like I mentioned. And most of the documentation you'll submit is all on the course page. And you can see here how it's evaluated. Mostly it's participation based. So simply show up and give me some good effort and you'll be just fine. If there is a skill that you're not mastering, especially under simulation, we do in-semester remediation. So basically all you're going to have to do is practice it with me again. And that's really for your benefit. If there's something that's not working out well, I want to make sure that you're good on that skill to move on and not send you out there still not sure of what to do. So it's just really for your benefit. Okay. Scrolling. Sorry, this is probably making you super dizzy. Okay, simulation. So this is me again. I already talked about technician and intern level functions, but what exactly are you going to be doing? That's the good stuff. So this is what you're going to be doing. We mapped out skills. So my background is in community pharmacy, and we mapped out skills based on what we think a competent community pharmacist should know how to do. And we don't touch on all of these in IPPE. We touch on them in the curriculum. But 80% approximately of our students go into community practice. So we want to make sure you're really good at the skills that are required of a community practitioner. So you'll see that in blue, those are the skills that are going to be covered in the simulation. In red are the skills that are going to be covered in the rotation that follows next summer. And so we do things like dispensing accuracy, creating a label, basic errors and omissions, so kind of like checking each other. We do a check example. We have you do DURs, which is where you look at a profile and you look at a prescription and you tell me whether or not you'd fill that prescription based on that particular patient, which is more of a pharmacist skill. We actually simulate taking oral prescriptions over the phone. You'll do it via voicemail a couple of times, and then you'll actually get to do it with a live caller, and that's super fun. That's in the spring. You'll get to counsel patients, which is something as a technician you've never done, hopefully. Because legally you're not allowed to. Well, every year people tell me they have, which always is a little scary. We'll talk about how to make a recommendation to a physician. And then in red, we'll get more into, on rotation, some of the insurance pieces that I can't very easily simulate. We'll talk about over-the-counter product recommendations, because you have me again in the spring to teach you OTC. And then some management scenarios and extra skills like MTM. So that'll all happen on rotation on site. But basically that's where the skills are focused. So what does it look like this fall? So the first simulation you'll do, which is in September, I think. September 11th is the first one. And that's not for everybody, so I'll show you the schedule so you know where you are in a minute. But it'll be focused on dispensing. So we'll focus on data entry, reviewing prescriptions for accuracy, assembling prescriptions. We have mock stock bottles, mock vials. We have a mock computer system that sometimes is quirky but still gets the job done. We'll look at profiles. And so it'll be more about dispensing. The second visit is more about counseling. So you guys are taking a communications course. It's on Thursday afternoons where you interact with mock patients, and it's interprofessional. It's with student physicians, and student nurses. And to build off that, we're actually going to apply communication skills to pharmacy. So you're going to be counseling a patient on some devices in a pharmacy. You'll be interviewing a new patient that's new to a pharmacy to collect the information that you need to process prescriptions. And then we'll talk a little bit about interprofessional communication as well. So it's dispensing skills, communication skills, visit 2. Any questions about the fall? It's fun. The spring is actually more fun because we mix it together. So the spring feels very, very real. So now that you've mastered those 2 things independently, we got to put them together because that's how practice runs. You never do, as a pharmacist, just one thing. You always do about 20 things at once. So in the spring, you'll actually be doing an intake interview with a new patient. You'll be counseling patients. At the same time, you'll be taking taking prescriptions off of voicemail and dispensing. All of those things will happen in one simulation. And then you'll do it again in the second time in the spring, but it'll be live. So you'll have to speak to a live nurse caller on the phone about a drug problem on a prescription. You'll have to take a live prescription over the phone from a live caller versus recording. So that's kind of how the spring will run. And we'll lead you through it, and you will get out just fine, but it is really fun. As far as how you're assessed, we do have rubrics for a lot of the skills, but like I mentioned, we're not saying 100% accuracy or 100% perfection is pass. So I don't tell you exactly where the pass bar is, I just tell you to give me your best effort. But usually pass is anywhere between a 60% on a rubric score and an 80%. So it's progress, not perfection. I don't expect a P1 student to be able to counsel a patient perfectly. Should be able to do that. Because you haven't had it, that's just not fair. And then you're also evaluated just on showing up. Any questions about simulation?
So there's 2 visits per semester.
2 visits per semester.
Where do we go for that though?
It's all in the basement, yep.
Okay.
And I'll show you on the schedule, it's pretty clear. So we'll get to that at the very end. I'm going to skip over, avert your eyes here because we're going to scroll fast. Dr. Gray's stuff because he'll be in a little bit. And we're going to skip to service. Here we go. Okay, so part 2 of the 3-part requirement is the service requirement. So all students have to complete self-directed and self-identified service hours. And it's a breakdown. So some of them are professional service, and we'll talk about what these mean. And some of them are personal development. All hours have to be approved. I approve them. The attire is designated by the event. So if you're going out and giving flu shots in October after you're trained, you probably are going to wear your IPP attire. If you're going to do a drug take-back event, you're probably in jeans and a nice t-shirt or a Gatton College of Pharmacy t-shirt. So it's going to be based on the event. And typically the events are sent out via email, but let's talk through that part a little more. So, there we go. So basically, we think as a future pharmacist, I have to do CE to keep my license. You guys will too one day. I think it's, Susie, are we every 2 years or every 1 year? I get confused every time. It's 30 hours every 2 years in Tennessee.
Yes.
When you're multi-state licensed, you're sometimes like, I can't really remember which state I'm in. So anyway, it's all on an honor system. I self-select what I want to do continuing education in. I have to track my hours. And so the idea is to get you ready to be a professional where you have to do your own continuing education and development. Because part of being a professional is always kind of improving. And also, we think that by getting out in the community, you're going to learn more than I can probably ever teach you in a classroom. Because by doing, you learn so much better. And so this is a way to encourage you to do, to learn by doing. So basically, here's the layout. See if I can zoom in. You can see that better. So it's a total of 10 hours. So the first thing is those 10 hours are occurring across the whole year. So you don't have to do these all in fall semester. You don't do 10 in fall, 10 in spring. It's 10 from today until April 30th. You've got a whole year. You can do these over breaks. You can do them on the weekends. You can do them after hours. You can do them at any point in time. They just have to be approved. The breakdown is a 60-40 split. So 60% or 6 hours have to be professional service. What that means is it has to be a medically related outreach, either service or education event. So we'll go through some examples of what is and what is not. But things like immunization clinics. If you're going to a local pharmacy and talking about the importance of getting your flu shot, that would be something. If you're doing a drug take-back event, if you are talking to people about using naloxone, the opioid overdose agent, all of those things are related to the practice of pharmacy and their service to the community. The other 4 hours are falling under personal development, and they can be one of two types. Doesn't matter how many hours in what category, but both categories are available. So you can do all 4 hours in one category, all 4 in the other. And the two categories are community service. So that's volunteerism that benefits the community at large, or personal development, which is things like lunch programs about a disease state. Dr. Melton offers those quite a bit. Maybe it's a program about study skills, just making you a better student. Maybe it's a mock interview session. Maybe it's a clinical competition that you sign up for. So it's anything that makes you a better person or professional. And the list is pretty broad. So we'll talk through some examples. But 4 hours in any split of those two categories over the whole year. Any questions about that? And then we'll go through some what counts for what. Was that your question?
Yeah. So whenever you said that they got to be approved, do we have to have them approved before the event? Or could it be after?
We'll get to that. So the first thing to know is the max you can claim for any one event is 2 hours. So let's say you go to the Tennessee Pharmacists Association winter meeting in February, and you're there for multiple days. The most you can claim for going is 2 hours. The reason that is because that most events are 2 hours, and I want you to get 2 different events, 2 different experiences over the course of a year. It's not hard to get these hours. It's not hard to find opportunities. You just A, have to be proactive in looking at them. And B, we want you to get more opportunities to grow. And so if you were able to wipe out all of your hours in one event, A, I can't control what goes on there, and B, it's limiting to you. So 2 hours per event is the max you can claim. So basically, I already talked about eligibility. They can be hosted by student organizations. They can be things that you all identify. That's totally fine. They can be things that are housed through programs in the community. They can be things that are housed through College of Pharmacy. So lots of things go. If you're thinking about a service event, you fill out a form. And the form is linked. It's available on D2L, and it's linked in the syllabus. And basically, you just provide this information as much as you can. So I need your name, the type, so which category does it fall in, what's the name of the activity, when's it happening. If it's a student organization that's affiliated with, you gotta list it there. The location, your preceptor information, especially if it's a professional service. So if you're doing an immunization clinic, as a student, you can't just go out and randomly give flu shots. You need somebody who's licensed there to oversee you. So you need a pharmacist preceptor. If you're doing a trash day, like a beautification day on the VA, you don't need somebody to oversee you do that. So it's event specific. And then give me a little tidbit about what you're going to be doing. You can do signups 2 ways. So some signups that are closed They're only available to like members only, maybe it's only for you as an individual. And then there's other signups if you want, if you identify an opportunity and you say, you know what, it can take like 10 people, let's make it available to my entire class. The Office of Experiential Ed will send out communication then to anybody that's appropriate to participate, and they can sign up. So you just tell me what you prefer. And then you have to specify how many volunteers, how long will people be volunteering, what shifts are available, and then just anything that a volunteer would need to know. So if I was signing up for an event, I'd probably want to know when do I have to be there and what do I have to wear. And so that's what's on there. And then anything else you have to bring. So it's pretty common sense, just general things that we would want. So you submit that. I review all those and approve them. And we award hours based on the time you'd be volunteering. Typically prep time does not count, so it's just the time you're on site doing the activity. I would say 98% of things I approve flat out. There's only a couple of things I've ever really denied, and they're just usually on technicalities. So like it didn't benefit the community at large. It was more of a volunteering for an organization. And we'll talk through some examples. So once they're approved, you'll get a notification that it's been approved, and you can go ahead and advertise that to other people. You can, contact the site and then confirm that you're going to be there. If it's open, we'll post it for other people to sign up with you. And then afterwards, all I need back is a sign-in list. So please make sure to turn in some sort of list that says who was there, just so we can kind of confirm that people actually were at the events they say they were. And then you have to log your hours. So to make sure that everybody's in compliance with the total of 10 hours and the 60-40 split, we have a Google form that we use. And this is all on D2L, I'll show you. I try to keep the D2L pages very straightforward and very easy to use. But basically you just put your name, which course, so you guys would be the P1 course, the event date, the time spent, and the type. Once you hit the type of activity, it'll pop you out to a second window, and it'll list all the activities that were approved for that type of hour. And then you just select whichever activity you participated in. Fairly easy to use. If the upperclassmen talk to you, this is much easier than what they had to do last year. That was a big headache. A caveat, so I remember at the very beginning when I started talking about this, it said self-identified. So we do not, in the Office of Experiential Ed, we do not guarantee availability of spots for open events to students. Basically, it is on you to find the activities that you're going to participate in, and I'll tell you how you can do that. But it is not my responsibility to find activities for all 240 students in the building. I simply cannot do that. I do reach out and I'll find health fairs that you can participate in. I precept a lot of those. I have relationships with a lot of community places where we do educational sessions, and I always open those up to sign up for anybody to participate in, but I can't find everything. So student organizations are probably our #1 supplier of service hour opportunities, and in some cases you do have to be a member to get access to those service hours. So if that's not an incentive to join, or if you didn't have an incentive to join already, that might be an incentive. And then you can always find opportunities on your own. It's just a little more work than waiting for something to come through OEE or something to come through student orgs. So what would things like that look like? Let's talk about it. So events that are eligible for hours can be hosted by student orgs, college affiliates, so internal events, or external events, things that are through religious organizations, public organizations, maybe things like Boy Scouts or Girl Scouts, could be through the local veteran, like the, I don't know, what are some clubs, like the Rotary Club, things like that. You can do hours for things that count towards certification requirements. So how many people are certified pharmacy technicians? So you have to do continuing education for that, correct? So you can count, if you do an online CE program or you go to a meeting, you can count those towards your professional development hours. Those are fine. I'll count those. And then if, let's say you're going to rush PDC, Phi Delta Chi. Phi Delta Chi, for their members, has a requirement that they participate in so many outreach events, probably community service events. Those activities that you do for PDC, I'll count for service hours. That's totally fine. But that brings us to what doesn't count. So things that double dip do not count. Those were the only exceptions. So if you're paid to do, let's say you're giving flu shots at work and you're paid, you're getting money to work there. That does not count as a service hour. You cannot get paid paid when you're providing the activity. So if you were going to participate in a flu clinic at CVS or wherever you work, maybe just ask that you can not do it on the clock time. The reason is the same reason that we have an issue with scheduling students at their work site. You can't get paid, and we can't have that count towards any IPPE hours per accreditation standard. So that's an accreditation issue. You can't participate in events that are hosted during class time. So unfortunately, I can't condone you skipping Dr. Hurley's class to do a flu shot clinic. Dr. Hurley's probably not going to be very happy with me. So you can't skip class to do a service event and get hours. That's not going to work. You can't count towards service hours and have it count towards a didactic course. So a great example of this, Dr. Melton sometimes does lunch and learns for her third-year students. So she brings patients in at lunch, they talk about their disease state, the same one they're learning about in class. And if they go to so many, they get a bonus point towards class. They can't count towards IPPE hours, though, because it's feeding into their course grade. So for you all, it would be CPOP in the first year. There might be some things that they ask you to do, like an etiquette dinner. That's usually one. So that would probably be an example of professional development, but it's for a course. You can't double dip. Does this make sense? No double dipping. Okay. Let's go through some examples and how you guys think we would classify them. So what if it's a presentation about presentation about prescription drug abuse at an elementary school? What category? Scroll up there. There we are. What category do you think he falls in?
Professional.
It's professional service, absolutely. What if you're volunteering at a soup kitchen?
Personal.
It would fall under personal, and it falls specifically under community service. What about, we already kind of talked about, like a state, local, or national meeting? Professional development, because you're bettering yourself as a person. What if you're doing blood pressure screenings for attendees at that national meeting? And it's service, yeah, because it's you're serving others in a way that's related to pharmacy. How about shadowing a pharmacist? This one was kind of common last year. So it's actually professional service. I will count it as professional service. I would encourage you to try to find other service opportunities. Not that I don't think that shadowing isn't a good one, but you're not doing as much to serve others as you could through other venues. But if you're really having a hard time finding things, I will count shadowing towards professional service. I prefer that you went to the same pharmacist you want to shadow and say, hey, can I set a booth outside your pharmacy and talk about seasonal allergies or talk about why people should get their flu shot? To me, that's a little bit better use and a better fit for professional service, but I'll still count them. So other things that would be under professional service would be things like a flu shot clinic, an education presentation at the Health Resources Center, which I'll send out opportunities for, participating in a health fair. What if you're advocating for, what if you go to Senator Phil Rowe's office and you're advocating for a statewide, statewide registry for some sort of medical information? It's professional service. So you're doing something on behalf of pharmacy, and advocacy is kind of in the same vein as education. So we would count that as service. Okay. How about some other kind of tricky examples? So how about, we already talked about if there's a flu shot clinic that occurs during class time. So you are welcome to participate, but I can't give you hours for it, and because I can't green light that one. How about serving at a church dinner? So it's actually not approved because it's not benefiting the community at large. So that one came up last year. It's kind of like if I'm part of a club and I'm serving other members of my club, it's not really community service because I'm already serving an organization I'm part of. It's not for the betterment of the community at large. So you got to think, is it for the community at large? Now, if your church is hosting a breakfast and anybody can come and it's for the community, that's community service. If it's a benefit for the church, it's probably not. How about if you're serving as a student ambassador or a tutor for somebody else in your class?
Tutoring wouldn't count because don't you get paid for that?
So tutoring wouldn't count, especially if you're getting paid. What about a student ambassador?
Personal development.
It actually doesn't count. Well, yeah. So the reason it doesn't count is, what do I have in my notes here? Sometimes we do nice things just because we want to, not because we get credit for it. That's exactly what I have written down. So as part of my job, I do a lot of service on national organizations, but I do it just because it makes me better. But it's not something that, I'm trying to think of how we could say it. It's not really developing you. It's a volunteer opportunity that you're taking advantage of. It's kind of like if you get a position in a student organization. It's a great thing to do. It's going to look great on your resume. It's going to give you a lot of skills, but it's not really above and beyond. It's not meeting the need of what we're looking for. So stuff like that it's harder to measure. It's not really what we're looking for. How about hosting a fundraiser for a charity?
So can you say who tell us about other organizations? So like would that not count?
So if it was something that was using like an appoint system for a student organization, you could, so back up. So if an organization has a point system and an activity would count for both, that would be appropriate. But unfortunately, fundraisers would not count. The reason is you're sitting at a table collecting money, but you're not actively doing anything. You're not going out there and like benefiting the community. Raising money alone, it's too hard to quantify the impact. So community service would really be doing more so than fundraising. Does that make sense? Now, if you're doing like, if you're walking, so if you participate in like the Relay for Life, that's community service. That's totally fine. You're kind of actively doing something. You're probably educating. You're interacting with other participants. I'll count that for community service. But if you're just have a table out in the lobby collecting money for whatever charity, St. Jude's or whatever it is, it's not really active community service.
What about like a car wash fundraiser?
Car wash fundraiser? I'd probably have to debate. I would say probably not. Just because you're not going to be as interactive. And if it's only raising money for like a certain fund, it's a little less community centric, if that makes sense. Beneficial, but not probably credit worthy. All right, how about if you go to SNAFA's chapter meeting that's Monday after next? Depends. So if it's just an update about this is our organization, this is what we're doing, then you're not really getting anything out of it. You're just attending a meeting. And that's another example of you're doing something, but it's not necessarily in the same vein as what we're looking for. However, if they had a speaker about cultural competency, so SNAFA does a lot with underserved patient populations, maybe they're talking about cultural issues in patients that you serve. That's absolutely professional development. If it's just a meeting with updates, or a chapter meeting, or a committee meeting, probably not. It's just planning. It's more informational. Are these making sense? Okay. How How about, I'm not sure why I wrote this one down. How about Wine Wednesdays, which is a series of roundtable events for professional development? So, it would be a great opportunity, and I probably would sign up, but I can't approve events that have alcohol at them for service hours. It just goes against probably the policies of the university. So absolutely go and do those, but we probably wouldn't approve it for hours. Unless I talk to the dean and she's okay with it. Okay, last one. So how about a featured speaker on main campus that you hear about, and they're going to talk about the importance of bees in our ecosystem. So bees are on the decline, like bees. Bees. Bees are, sorry, I wasn't sure if that translated. So bees are on the decline, and they want more people to have like at-home hives, and you're super psyched about that. And would that count?
Community service.
Community service would be a big stretch, but probably not. So it's not benefiting the community at large. It's benefiting the bee community, but maybe not the community at large. It's got no relevance to our profession, and it's probably not really going to help you as a future professional develop. So that one probably would not get credit either, unfortunately. But study skills, absolutely. Yeah, I've seen a ton of different ones for professional development. That's the one that's wide, very, very wide open. And community service is equally wide open. So are we feeling pretty comfortable with what would count for what? Okay.
I have a question.
Yes, sir.
What about packing the shoe boxes full of items and sending it to across the oceans?
Yeah, and some people do like angel trees for little kids at Christmas. It's probably one of those things that it's a good thing to do, but it's not necessarily immediately impacting the community. You could always submit it and I'll look at it, and depending on what you're doing, it might be.
Okay.
But we're trying to get you out there and doing things. Yes?
What about translating?
Translating, it would depend on what you're translating for. So if you were maybe like signing at an event or something, or if you were translating an event, yeah, I think depending on what it was, it might be community service.
Okay.
Yes, Gillian?
Do you have to submit the form before you do it, or like if you go to a meeting and there's like a speaker there, can you submit it after you go to the meeting?
So I prefer you to do it before you have the event, just because it's easier for me to tell you before you do it, before you assume that there's hours. Let me look at it. So for student organizations, we always try to say, send them in first. I have approved things after people have done them, though. So if you do something and you're like, oh, shoot, I should have submitted that for service hours, send it in, and we'll still be probably okay with that. We prefer to get them, though, prior to you participating. Yes?
I've got a two-parter.
Okay.
Is there a way to look at the hours that we've logged thus far?
So that's a great question. So the way we're changing it this year, in the past you used to have to go on the eValue system that Dr. Crow was talking about, but it's very infrequent that you ever use that system, and sometimes it doesn't work exactly the way we'd like it to. So the Google form collects your logging information, but it doesn't allow you to run reports, unfortunately. What we're going to do so that you know how many hours you have is send out monthly audits, and it'll show for, was it Parker? For Parker, it'll say, okay, she's got 2 hours of professional service, 1 hour of community service, 2 hours of professional development. And that way you know, okay, well, I gotta get some more professional service. And we'll try to do it every month. And that way you guys know, you'll just have to keep an eye out for those. But there's no way, with Google, there's no way to run a report to see your own submissions. Second part.
Probably less beneficial with that answer, but can you log more than 10 hours?
So you can, but they don't carry over. So if you, that's probably a good point about technicality. So they typically don't carry over. The summer, so next summer if you want to submit hours, they can apply towards the second year. And then if you, like so on and so forth, do hours, they'll apply to the coming year. Or for some reason, if you don't get enough hours, you'll unfortunately fail the course and then have to probably complete your hours that you were in deficit of next summer. Please don't do that. There's no reason you can't
complete these during the school year. It really isn't. Thomas?
Is it 10 a year or is it 10 a semester?
10 a year, 10 total.
Oh, okay.
Yep. And you can do them over Christmas break, you can do them over the weekends, you can do them at night, you can do them at any time. Just not when you're supposed to be in class. Yes?
Do they have to be in Tennessee?
They do not have to be in Tennessee. No. Dr. Gray?
I was going to ask you a question. The question earlier about providing resources to a group, whether it be national or international, if they were addressing a specific medical need, would you?
Probably, yeah, probably. The Angel Tree one is the one that stuck up to me. It's not as, so it's going to be kind of dependent, yeah. Usually the more relevant to the practice of pharmacy, the more likely they are to get approved. Things I've denied before, though, are things that are service, but they're service to a group you're part of. It's not really community service. And then usually the ones I deny are ones that happen during class time. Yeah.
Is the 10 hours like for the P1 year, or is it like 10 hours each year?
It is actually, so it's the same requirement every year. So you'll have the same 10 hours each year and the same breakdown of hours. So it's always the 60-40 split. It's always 10 hours. And so once you get the hang of it this year, it's exactly the same. We used to actually do all 30 hours in the P3 year only, and that was a lot of time. So it's much better now that it's spread out. It's kind of incentivizes you all to get involved, to get out in the community earlier, and so it's meant to help you in the long run. Yes?
I know that you mentioned earlier that no matter how long the event was, we'd get 2 hours for that event, and that's for every category?
It is, okay. Yeah, 2 hours max per. But an example would be, so Dr. Gray was asking a couple weeks ago about that we have a rural area medical clinic that's coming up in November, and it runs from Friday to Sunday. And I think the question was, well, what if a student volunteers Friday, Saturday, and Sunday? Can they only get 2 hours? The answer is no. For service events, if you're signing up for multiple shifts on different days, you can claim hours for every day you sign up. So you could get, if you had an event that was over 3 days and you did 2 hours a day, you would get all 6 of your required hours in that weekend. The same thing's true if there's flu shot clinics that typically we push out. And so if you have a flu shot clinic in August, there's one in September, and there's one in October, you can do all of your service hours strictly through flu shot clinics. That's fine. I probably would encourage you to try to get some diversity so you grow in different areas, but if that's really where you think you want to focus, that's absolutely fine. So service hours, usually you can get 2 hours, but it's 2 hours per volunteer time. Things like national meetings, I just do 2 hours and that's it. Because usually you're doing things like networking, which while still important, sometimes we have a little less control over what exactly you're doing at those meetings. So that's why we capped it at 2.
At the national meetings and whatnot, when you gave the example earlier of doing running people's blood pressure while you're there, could you claim professional service and professional development 2 hours for each?
So yeah, so some students have done that. So sometimes you're at an event where you have 2 hours. It's kind of a specialized thing, but yes, just ask me if you have a question where things might apply differently. Luke?
So will we get trained in class for vaccination, or we can actually go to the professional service?
Yes, you have to go. So P1s will not be eligible to participate in any flu clinic until you've been through the certification program, which I'll show you the schedule here in a second after we cover Dr. Gray's section. Feel okay about it? Okay. So with that, Dr. Gray, I'll turn it back over to you if you want it.
Were you going to give a short break or you transition in?
Well, we're almost done, so if you guys can hold out with us, I'm seeing nods, then I think we are, and I have your syllabus addendum too if you want.
Okay. Actually, I was going to speak off the cuff, but
I got it in here. Move it out of your way.
Good morning. I know you guys have been here for a little while, so I'm asking for only about another 15 minutes of your time or so. I think I'm on the agenda for 20. I don't believe I'll need that much time, but I wanted to share with you something that you will experience over the next 3 years. I'm rather fond of it, and hopefully you will be as well. It's an opportunity for you guys to get out and meet some individuals that you probably, potentially might not have otherwise. So I understand you had some introductions on Monday morning, and I know that this is my first time in front of your class, so I thought I'd give a brief introduction, and then we'll ask you to participate with me into something. So my name is Jeff Gray. I'm a pharmacist, of course, with Mercer University. I'm originally from Southwest Virginia, not far from here. So some of you may have gone a similar path. I've done a number of things in practice, but I'm currently in a geriatric practice. I work with a very innovative long-term care practice, which is not far from here, within a couple of miles, actually within a mile. And they service a lot of homes in a fairly wide geographic area, certainly our local area. Even when you consider our region of 50 miles and even further, they have a satellite campus in Nashville and service quite a lot of Tennessee and even some other surrounding counties into North Carolina and Virginia and so on and so forth. It's a great practice. It's a great opportunity for pharmacists to step forward and work in a geriatric practice. Whereas you guys probably already know, if you've had any experience in pharmacy, those are the patients that have, in many cases, the greatest medication demand, or prescription demand. So it's a great opportunity to work with them and consolidate and do other things that benefit them in the long run, certainly. So I am going to ask you to sit. I know you've been sitting for a little while, but I want to let you sit and think for about 30 seconds. And I want you to ponder a positive experience that you had with someone, an elderly individual, let's say someone over 60 or 65. They could be 95, they could be 65. It could be a relative of yours. It could be someone that you've met through pharmacy. It could be someone that you've met or entertained in your home or outside your home. I want you to just think about, for 30 seconds, when I think about a positive interaction that you've had with someone of advanced age. You can think about the dialogue that you carried, the rapport that you built. It doesn't matter to me. I just want you to think about a very positive experience that you've had with someone of that age generation. All right, go. Give me 30 seconds. My second hand's not working on the other clock. I use my own. All right, good. All right, so the practice that I'm going to ask you to be involved in is called Think, Pair, Share. So ultimately, I want you to connect with someone around you, your left or your right, one other person, so a pair of two, and I'm going to ask you in a moment to share what you thought about that positive relationship, that positive communication, dialogue, whatever it happened to be, in the context, and you can share the environment or otherwise with the individual next to you. But I thought I might give you an idea of what I was thinking about. My grandmother, she's since passed. She was in her early 90s, sharp individual. She was born in 1912. And at the time of this discussion, I had a number of conversations with her. We were relatively close, but had lived apart because I lived out of state for a number of years. And my wife and I brought in a video camera. And I asked her if she would mind if I videoed her for a short period of time, just collecting some of the things that she had experienced as a child, references that she had as a child that we could kind of capture. And so over a short period of time that I spent with her, I had, of course, a laundry list of questions, and she was able to provide a lot of background and context to her upbringing and my family and individuals' names that I wasn't familiar with. And so obviously I spent a little bit of time on Ancestry.com since that time was on advertisement, but it was kind of interesting to find out even more information. It was a very positive experience, and I learned a great deal about her health and obviously many of the other things that related to her at that time. And so that was just one of the positive ones that I have in mind. There's certainly been many more recently, but hopefully you guys identified one. All right, so now I'm going to give you about 60 seconds each. Turn to your partner or peer or colleague and just share some of that positive experience that you had with an individual and provide a little bit of context. You're limited to 60 seconds, and I'll give you a stop. Time to switch partners. Now the other one should be speaking. I'll give you 60 more seconds. Refocus. How was that? Pretty good? All right. Excellent. So now, the reason I did that was I wanted you to think about this program and your introduction to someone of advanced age in a very positive light. And hopefully this has enabled you to do so. So ultimately, I understand you've had a little bit of information given to you about Cornerstone as it's involved in the IPPE process. And ultimately, what you'll have the opportunity to do is to meet someone of advanced age who lives in a local community, and you and your small group will have an opportunity to build rapport with them, find out a great deal of information to them that hopefully will benefit you in your education, but equally important in my mind, or maybe even more important in my mind, is that you'll be able to benefit them as well. And so their community will expand, and the things that they'll be able to do and the exercises that you'll provide them with just through the question and answer type activities will be of great benefit to them. This is a program that's been going on for a couple of years, and I'll tell you the feedback has really been overwhelmingly positive, both on the student side and on the resident side, and I'm delighted to hear that. So let me give you an idea of some of the activities that you'll be in, and I'm also going to give you some encouragement as we go through this process. So each year you'll have two scheduled visits with a local resident. Your small group will be assigned that resident, and as P1s, you will have that resident, and there'll also be a P3 group who will have the same resident. Now, as you might imagine, your dialogue will be a little bit different because you'll be meeting them for the first time, and it's very likely that the P3 group probably has already built some rapport with them and had some exchanges with them. But also, as you go through the curriculum, you will advance the complexity of the discussion as it might relate specifically to pharmacy. So in your first year, you'll actually have very little discussion with them, and I would discourage discussion with them related to their specific medications or even specific disease states that they've occurred. Now, they may share with you a little bit about this, but I really want you to get to know them as a person. What has driven them? What engages them? What creates emotion and passion within them? These are the things that I want you to capture and provide back to the resident. Yes, I said back to the resident. So your small group will create what's referred to as a life story work. And if you create a life story work about this individual, it tells me that you've gotten to know them pretty well. You've heard a lot about some of the events that have really made a mark. It's been notable in their past. That's obviously influenced their current time and may influence you as well. But additionally, it's been found to be beneficial for individuals to go back through memories, and it's been found to be productive for them, maybe even protective of their memory, to share these experiences, whether it be with someone of your age, younger, older, a family member, it doesn't really matter, but you get to be one cog in this particular wheel. And so at the end of the first experience, you guys in your small group will create what I refer to as an LSW, or life story work. And then I'll review those and provide them back to the resident. And then the resident's encouraged to share them with their family members as well. And it's really been pretty remarkable, the things that have been shared. Families have, maybe found that this is the first recorded time that this story or event was shared, or that they're familiar with it. So it really could be a pretty powerful activity. During the second semester, your visit will be a look at their perspective on illness and social determinants. So what do they feel has affected their progression? Maybe this particular disease state, or maybe their health. Maybe they're in their early 90s or early 100s, and they're in great health compared to some of their peers. What's been protective for them? And so this would be a good thing for you guys to hear, and a good thing for them to share as well. As you progress to your second year, you guys will create a health systems story work. And so many of the residents, as you might imagine, let's say they're in their 80s, they've had a number of events that have dealt with healthcare providers. And so I really want you to capture what types of activities during the second year, what types of activities have made an impact on the way that they view healthcare providers, and ultimately pharmacists as well. You'll be involved in more specific contexts with geriatric care in the second year. And in the third year, will be more highly, as you might suspect, more highly focused on disease states and the individual medications. Medication reconciliation and other things that third-year pharmacists or third-year students are really geared to do and have had some experiences with. And so you get to do this, obviously, with your individual that you built rapport with, and you get to do this for their benefit as well. And so you can see that as a progression. It's certainly a longitudinal process, and it's one where we hope that the rapport that you build up during the early part will carry forward. Now, in reality, there's some things that also will come forward that are rather difficult to discuss. Individuals will go through health changes, right? It's very likely you'll get to know them for 3 years. And they'll go through health changes. If they age from, let's say you meet them at 92, and they're 95 3 years later, very likely they could have seen some changes in their health. Maybe changes in their vision, or change in the certainly number of medications that are on potentially. Other things as well. There's no guarantees that you'll be with the same resident for all 3 years. There are changes in living environments. There are, of course, changes in the number of residents who we have volunteer for the program. And of course, we have had a couple of residents who have passed away during that time period as well. And so those are things, though, that are healthy for us to discuss in a small group, or healthy for us to have dialogue here, because we certainly, as healthcare providers, are faced with those sorts of changes, and we should be prepared to see that. And so I wanted you to have a very positive reflection on Cornerstone, because it certainly has been for all the students and the residents, and I hope that you'll have the same sort of experiences as well. I know that some of you are thinking, oh my goodness, I've never really been put in an environment where I need to be able to ask questions of someone senior that's not related to a specific medication or so forth. Well, take comfort in that you'll be with your small group. I'll give you some guidance before that, and look forward to it. It'll be a really an engaging time, I hope. So questions you have about Cornerstone and the longitudinal process? No questions? Wow. Dr. Alexander, what did I miss?
I think you got most of it.
All right. There are a lot of expectations in regards to being prepared for the process, and those have already been discussed. And so come in prepared, come in open-minded. You'll learn a great deal if you do so. Thanks for your time.
Okay, last couple of things, and then I'll get you guys probably out of here. Okay, first thing is the calendar, or the schedule. So here is the schedule. I'll show you where it is on D2L. So as you can see, if there's nothing in the calendar, if you look at your course schedule, does anybody have a picture of your course schedule, the color graphic one? So there's IPPE time blocked off on Mondays and Tuesdays, I believe in the afternoon, from 1 to 5. Correct? It's in gray. So next week, you'll notice there's nothing on the schedule. If there's nothing on the schedule, there's nothing that's going to happen during those times. So they're block times, but I think that's the other reason why we felt like things like the service activity and some of the pre and post work wasn't asking a lot, because you're not actually meeting for this course every week. It's just when scheduled. So if there's nothing there, there's no requirement, but please make sure you're working ahead. We also, for some reason, sometimes things that are course requirements or college requirements fall into IPPE, and sometimes things that are Office of Experiential Ed requirements fall into this course. So for example, on the 28th, so on week 3, if you have not yet done your basic life support training, during IPPE time on that Monday from 1 to 5, there will be the training offered, and that's held through Student Affairs. So if you don't have your life support training yet, make sure to get with Michelle Graybeal to sign up, and it'll be on that day. I kind of try to color code things as much as possible. So I mentioned on Monday, September 11th, will be the start of day 1 of 2 days of simulation. So if you are in learning groups 13 through 16, you'll have simulation that day from 1 to 3 p.m. down in the compounding lab in 005. If you're in groups 9 through 12, you'll go from 3 to 5. If you're in groups 1 through 8, you're going to go then the 18th, the next week. And I kind of try to rotate them, so it's not always the same people going first. It's not always the same people that are stuck last. So they rotate throughout the semester, and then semester to semester. So just make sure that you know which learning group you are and which time you're scheduled and which day you're scheduled, because that's a theme also with Dr. Gray's Cornerstone visits. It's by learning group, and so it's a little bit of a problem if you show up. Now, if you have a problem with scheduling, if you have something where you would have an excused absence, please email me. If it's Cornerstone related, please email Dr. Gray so that we know in advance and can kind of make a plan. When in doubt, email me and I'll filter it to him. But really, for the longitudinal portion, I'm probably the best person, because if it goes to the Office of Experiential Ed, and Dr. Crow and her staff really don't oversee much with the longitudinal piece. I mentioned that other experiential requirements sometimes fall during IPPE time, and that's true here in the end of September. So Dr. Welch might mention to you tomorrow that we do the training for your immunizations during IPPE time, and that's actually on 3 different days. And unfortunately, due to room availability, one session is not actually during IPPE time. It's during time that's free on your schedule, but we weren't able to get enough rooms during the times that we needed. So Friday, September 29th is not a time on your calendar that's blocked, but there is something scheduled. So that one for sure I need to make sure you have on your calendar. Friday, September 29th from 1 to 5 is actually the practical portion of the training. So that's when you're going to be doing the injections. We'll be practicing. And this will be posted, and you guys all have access to this now. The Cornerstone orientation, Dr. Gray will probably send out more information about where it is, how to get there, where to park. But it's on Monday the 10th or Monday the 2nd of October. And you can see the location and date there. And again, he'll send out more specifics about like the specific address for that. And that is all students. And then you will visit Cornerstone in your small groups on one of 2 days, either October 9th or October 10th. And you can see there groups 1 through 8 are going the first day. On Monday, groups 9 through 16 are going the second day. So I can email this out to you all too, so you have it if you don't have to write down frantically. The second simulation is at the end of October, so they're roughly a month apart. And again, we're doing a Monday-Tuesday split. So depending on what group you are, you're not actually scheduled for that full 4 hours, just 2 hours of that 4-hour block that's on your calendar. So you're just responsible to make sure you come at your assigned time. And then on October 31st, on Halloween, that is a due date. It's not actually meeting, but Dr. Gray's assignment, the life story work assignment, is due on that day. And so that's just to kind of clue you in that that's coming up. The last thing on the calendar then, I think for the semester, is the spin orientation. And that's where you give your preferences for location and timing of that summer rotation next May through August sometime. And so that's going to be November 6th. And so this is all available to you early. If you have conflicts, the sooner we know, the better. So let me know. And if it's things that you can work around, we highly suggest you adjust your calendar appropriately, because most of this is during the scheduled time on your calendar. It's with the exception of that one Friday. Any questions about the schedule? Pretty straightforward. So anytime that, like say, anytime that is nothing shown, that's time you can do service activities, that's time you can do pre-work for either the Cornerstone experience or the simulation experience. It's time you can study, or it's time that you can, do with whatever you want. So there's plenty of time in this course, so please make sure. That's why I say there's really no reason for things that are self-directed, like the service hours, that you can't get those done. Okay, let's go back here. So we talked about who do I go to with whatever situation. We talked about testing out and why, unfortunately, we can't allow that. Most things are on D2L, so the where do I find, if you go on D2L, everything is kind of tabbed here, so I can't zoom in, but general course documents will have the full syllabus, it'll have the calendar. I try to post the schedules pretty far in advance, so spring schedule I'm hoping we'll have probably out in November before you guys even go on break. We should know what the spring will look like. And I also give you like a little to-do list. If you're like me, I like lists, so that just helps me keep track of things better. The simulation activity, there's an overview, and then for every simulation there will be its own separate little page. So if you know you're coming in for the first simulation, there's a ton of documents posted here. All the pre-readings are there, the description, and then some of the activities that we'll actually do on the day of. Patient care experience is the Cornerstone experience, and so there's information that'll be posted there, kind of directing what you'll do on site. And then all of the links to the service requirements are posted under service requirement. So the event approval form, that online survey is available, and then the logging form is also available. So when in doubt, just check on D2L. It's pretty easy to navigate. Okay, so that brings us to professionalism. So I'm not going to belabor this. We've talked about this a ton. So our expectations are here. For professionalism, to me, it really falls into probably 3 main categories. Make sure you stay on top of things, including your email. So it's our expectation, because we don't actually see you in a classroom week to week, we have to rely on email. So if you are not responsive to email, we are going to have a problem. If you're not updating your contact information, including your address and especially your cell phone number, we cannot get a hold of you. And that holds everything up. So like Dr. Crow was talking about, we have to work so far in advance with site requirements, with getting you ready to go out to different places, that if you're not responsive to us, unfortunately in the end it just hurts you. But it is a big hassle for our office. It also can actually cause you to not complete satisfactory performance in the course. So I have a student who failed, in the past had failed an IPPE course, mostly because they just did not pay attention to emails. And it's not for lack of trying. We sent out, for that particular student, I had sent out something like 24 reminder emails to do things that I'd asked. And he did not do them. And so he failed the course. So don't be that person. Get your stuff done. There's really no reason why. So watch D2L, watch email. Please be responsive. Don't leave us hanging. When in doubt, stop up and see us. We're very nice people. We'd love to help you. Make sure you are timely. Make sure you show up. Make sure you dress appropriately. Keep a good attitude. Ask questions, and just do what's asked of you. It's really that simple. Just to make sure, though, that everybody is on the same page with making sure that professionalism is kind of adhered to, and because, so transitioning, I have lots of hats, and you guys saw me on Monday with the professionalism hat, professionalism piece. So our professionalism committee, I get roughly half of all the reports of problems come from Experiential. It's because people don't complete deadlines. It's because people have problems on rotation. It's for whatever reason. I think when you're removed from the college, the lack of follow-up sometimes becomes a problem. And to enforce that everyone understands the expectations, we actually have a professionalism contract that we're going to be using this year for both IPPE and APPE courses. It's available online, and so I think Annalisa is going to come up. We're going to talk through today, maybe am I correct on this? So we're going to actually try to have you all read and fill out this contract to make sure that it's one more thing you can check off the to-do list of not having to worry about at home if we can do it today. So if you can grab your laptops, we're going to have you log in and take care of this now. So no, it's actually an e-value, so we're going to talk through that here.
Past hour with your username and password, so you should now be able to log in even though you weren't able to earlier.
So if you go to webmail.etsu.edu, that's the web portal to access your email. Check that you get an email from E, and it'll be like an asterisk, I believe, value, and see if they have a username and password.
So several of us have trouble with connecting with Wi-Fi right now. So
Oh, are we having Wi-Fi issues?
It may come from Freight.
All right, hang on. Do we have anybody have an email from Debbie or Deborah Frakes?
Yeah.
Okay. So that's going to be where your login and password are.
Actually, I sent one this morning from Mills. The login and password didn't get generated out of the system with the yesterday's email, so I sent you one this morning, and it should be from Mills A.
Would it have gotten sent to not our school email, like to a personal email maybe?
Maybe it's in spam.
It's sent to whatever email we have any value, which should be your ETSU account at this point.
One person that did not have an ETSU email. Everybody else is ETSU email.
Does everybody have one from either Ms. Mills or Ms. Frakes? No.
No, not this morning.
It may still be in the queue.
It's not on personal. It's
Not really, if I show them.
All right, so guys, then what we're going to need to do, I'm going to need like a solemn swear that you're going to do this when you get home, when we get your access to you. So Annalise is going to show us where you have to go after you get the email. So the email will have log information, it'll have a link, and it'll take you to the eValue page. And so we're just going to walk through where you would need to go to fill this out. But we really need, this will be one less reminder email I have to send. So this will be a perfect practice for what we need you to do. So we need you to respond so we don't have to hound you to do this.
Dr. Crow, can you ask Debbie to try to resend that email while I'm talking about this and see if it'll come on through? Okay, so when you log in, you're going to come up with a home page that looks like this. This is our test student, a P1 test student we have in. And when you have evaluations, and this is set up as an evaluation, your professionalism contract is, you'll have an urgent task, and you've got a link that says you have pending evaluations. And you just click on the link, and it's going to boot me out because Dr. Crow signed in early this morning. So let's try it again.
So speaking of this, if you're not able to get in today while we're here and you have trouble, I can log in as any of you. So if you need help and you don't want to come up to our office, you can call me and I can walk you through it. I can see your screen just like you see your screen, and so can Debbie Frakes, who's in our office as well. So, okay, here we go. So we're going to get to our home page, which looks like this. We're going to, under urgent tasks, we're going to click on complete pending evaluations, and you will have a screen come up that shows every evaluation that you need to complete. So here's her professionalism contract, and we're just going to say we're going to edit the evaluation, and that's going to bring up your professionalism contract, which is in the evaluation format. So this is all the information that Dr. Alexander previously had on the screen, and I think y'all shared the document as well.
I don't believe, I think, Dr. Crow, did you send this out via email?
So that was attached in your email that you received yesterday from Debbie Frakes, so that you have the PDF form of it in email.
So please make sure you read through it. You know, we want to make sure that you're acknowledging what you're signing, so make sure you look at this, because these are our expectations, and some of them are not going to apply immediately. Some of them won't apply until you're out on rotation, or possibly even until your fourth year. But we'll probably have you glance over this every year just to make sure you remember sort of what we need you to do and kind of the standard we're looking for.
Okay.
We just sent it in the email again, the usernames and passwords, so they may have received them now. We didn't notice them to the transfers. You will get an email. We're going to send that email.
So I'll give everybody a minute to look and see if they have had anything come into their inbox. Not yet? Okay. Okay, well, we'll press on with this and just keep your eye on your email too.
All right, guys.
We're doing it.
Almost done.
We're almost there, because I know y'all are ready for lunch. So as you scroll to the bottom, you're going to have a date field, and you just need to fill in the date that you're doing it. Then there is a box with terms and conditions, and this link that says GCOP Student Handbook will take you out to the Gatton College of Pharmacy webpage that has the link to the student handbook. So you'll have to check the box, and then you sign using your mouse. And I'm not the best at this, but. And if you really botch it up, like I just did, you can hit clear, and you can try again. Because if you haven't done this
hard.
a lot,
We won't judge you.
hard. I need to be able to use my finger, but anyway, let's just say, yeah. There we go. And that was good. But you type your name below so we can actually. And then I'm going to say save my signature. And then one more step, you've got to hit submit. And once you submit that, we have a record of it that we can always report and pull up on you, but you can also revisit this as far as viewing it. Now, once you submit it, there's no going back from your side. You can't retrieve it and change it or anything like that. But you can look at it. If you say, hey, I need to remember what I signed, you can go under your reports tab, and you can evaluations completed by me, and here is where Tammy did her professionalism contract, and you just click on it and it shows you what you did. And that'll be true for any evaluations you complete as you get out to summer rotations and that kind of thing. You can always pull up any evaluations you have completed by doing that.
And we'll probably post more tutorials on how to use eValue. You don't particularly use it much during the school year, but that will always be on D2L, and we'll email you well in advance and let you know of how to run those reports and where to find some materials. So
Yep. And is that all you need?
that's all we need. So does anybody have any final questions or? And we probably should, now that everybody's here, so just to make sure you know who the Office of Experiential Ed staff are. The office coordinator is Ms. Debbie Frakes. She's in the back there. She's the frontline person, so if you come up to the office, she's the person you're going to see.
I'm the one who sent you the most emails, so please don't encourage me.
It did come through? Okay, it came through, so do you want them to take just a minute and go ahead and do it?
If you have it pulled up,
We have 15 minutes.
yeah, if you have it pulled up and are able to, if the internet's not working, obviously we'll send out an email reminder.
Yeah, we just did. So we caught this transfer students at the end. So yeah, you should get it too. They didn't have their, I showed them how, and it's in the slides, and this is actually the presence for some professionals. It's in the slides, so we post the slides, they'll have, I did post the slides too. It might be good to send out just an email with that, maybe from you, with just the contract. Yeah. The questions everybody said. Maybe I don't know, any deadlines or just quick things, because I think sometimes we get too much information on the news site. Yeah, they seemed a little like they couldn't see something out. Yeah, something about the same thing, had something like a dead spot. Did you guys find it? Yeah.
Is that the same one that's on the cornerstone requirement? Is that what it is?
So the professionalism contract is that document. So when you sign it on eValue, then that requirement's done. We just need you to go through and do that. So if you're doing it now, it's one more thing you can check off.
So the Office of Academic Affairs, I'm not sure.
Some of yours just came through.
It might work as some of our students aren't sort of modified sections, so it might just be because they are this is a player over here. To the